are the three big things we do. And in all three things, we have fun. So don't forget to use that hashtag right here. We took a field trip Friday to find a train, which may or may not have ever been there. I sometimes have hallucinations, but in the end, we found a train and a train conductor who was really excited to be a part of this hashtag. So use the hashtag so that we can get more and more people knowing about the resources that we have and basically bringing forth any sort of problems that they're seeing so that we can get them fixed, because we can't fix things that we don't know about. So really honored to be with y'all, and thank you for coming, and thank you for having fun with us.
All right. So before we go into the agenda, first of all, I wanted to introduce myself. My name is Kyla Franks. I am the training coordinator here at the Tennessee Justice Center and also a client advocate. It is very nice to meet all of you. I'm sure you've been receiving emails from me or have responded to something from me, so please come and introduce yourself. I would love to meet you. So before we get started with today, we have a little pre-test. Some of you may have already filled that out. If not, now is the time. We'll give you about 10 minutes to do that pre-test. Write your name at the top, and when you're done, please just raise it in the air and we'll come and collect it from you. So you have approximately 10 minutes to do that pre-test. All right, who still needs more time? I'm going to give you about 1 more minute. Please raise your hand if you're not done. You are not done. Okay, about 1 to 2 more minutes to try and finish up. And also, don't worry, we're not grading you. This is just so we learn how much you learn so we can effectively teach you in the future. All right, so we're going to go through a few housekeeping things now. If you haven't finished, feel free to finish up as we go through these housekeeping things and then raise it up in the air and someone will come collect it from you. So, we're not trying to be tricky. We'll do the same thing on our post-test. Our post-test will be the exact same as our pre-test. So if you think about what you didn't know during that pre-test, pay attention during the scenarios and during the presentation, because the post-test will be the exact same questions. So just a forewarning on that. So take notes if you want. Also, if you have not signed in, please do so during the break, especially if you want continuing education credit. We're offering continuing education credit for navigators and certified application counselors. So please sign in. We will send the certificates to you within 2 weeks, but if you don't sign in, I won't know that you were here, so you will not get a certificate. If you're attending via webinar, please watch the audio in addition to please watch the visual in addition to the audio. Otherwise, GoToWebinar will not track your attendance. Also, if you're on the webinar, please send me your scores for the pre and post test. We would love to hear about how well you did. So, a couple more things. If you have questions throughout the day, there'll be 2 TJC staff on either side of the room. If you just raise your hand, they'll come and bring you a wireless microphone so you can ask a question. You can also write your question on the Post-it notes that you got when you first signed in. And if you raise the Post-it note in the air, someone will take it to one of these poster boards on either side of the room. We'll answer all the questions on the Post-it notes right after the break and during the Q&A session. So if you have something that you don't want to ask out loud, don't worry. Just write it on the Post-it note. We'll answer all of your questions during that Q&A time. If you're on the webinar, type your questions into the question box, and we'll also answer it during that Q&A time. And finally, if you are coming back on day 2 tomorrow, please save your toolkit and bring it back on day 2 tomorrow. Bring back the materials again. So just so you are aware, if you're not coming back, that's fine too. A couple things that'll help you. On the slides, as we go through them, there will be links or page numbers from the toolkit. If you want, in the TJC toolkit for TennCare and the Affordable Care Act, when that page number is up there, you can go ahead and, Chris is holding it up, in that toolkit you can turn to that page. And that will help you to follow along if you are looking for where this is in the resources and in the materials. One more thing to help you. I think a lot of you have been to these trainings before or done this for a while, but if you're not and you don't understand all of the acronyms that are being thrown out, in your best practices guide for TennCare application and appeals, best practices guide for TennCare application and appeals, on page 10, there is a glossary of terms and acronyms that you are likely to encounter, especially if you're new to this. If there's something you don't understand, check this glossary. It could be in there. And also feel free to ask us and we're happy to answer. So today you have the agendas, but I'll go through it quickly. We're going to talk about TennCare basics, how to count household size, and once you know the household size, how to count income. We'll take a short break, and then we'll go through some coverage categories, the Magi TennCare coverage categories, and finally we're going to talk about how to close our coverage gap. So without any further ado, I'm going to invite Chris Coleman up.
Thank you and welcome everybody. My name is Chris Coleman. I'm a staff attorney at TJC, and I'm going to talk about two things. First, we're going to talk just a big overview of what is TennCare, what are these insurance affordability programs that were created by the Affordable Care Act, and then we're going to go into my very favorite part of the Affordable Care Act, which is the household counting rules. Has anybody ever seen my household counting rules? My presentation on that? It's good. But first, TennCare basics. The insurance affordability programs, there's a specific term in the Affordable Care Act called insurance affordability programs, and it actually only covers 3 of these 4 programs, but we included Medicare in here as well, which is not technically an insurance affordability program under the Affordable Care Act, but it makes sense to include it in this list. So we've got Medicaid, which, to make things very clear, we call TennCare, even though it's Medicaid, not Medicare. We call it TennCare. That is the Tennessee Medicaid program. Then Medicare, and I'm going to talk about the differences between those two. Then we have the marketplace premium tax credits. These were creations of the Affordable Care Act through which people can get subsidies to pay the premiums for health insurance when they buy through the marketplace, if they qualify financially for that. The marketplace, sometimes called the exchange, healthcare.gov, the FFM, which is federally facilitated marketplace. And then we have CHIP, the Children's Health Insurance Program, which covers children and pregnant women, and in Tennessee we call it Cover Kids. So first, I want to talk about the most confusing thing for lots of people. I still occasionally, I'll be talking about one and slip and say the other. I'll say Medicare when I mean Medicaid or vice versa. But I want to just make sure everybody understands the distinctions between these two programs. Medicaid is a federal-state partnership program. The federal government writes the rules and says, states, we're going to give you money. If you use this money, pay a matching portion of those funds and follow the rules that we set out, then you can participate in the Medicaid program. Medicare is wholly federally run. There is no state Medicaid program, a Medicare program. See, I did it. There's an old saying in Medicaid circles that if you've seen one Medicaid program, you've seen one Medicaid program. So if anybody has ever worked in another state with Medicaid, forget everything you knew before, because it's going to be totally different in every state it is. Medicaid is a means-tested program. Public assistance goes to people who fall in specific categories and meet certain income guidelines. While Medicare is based on work history, it is an entitlement program for people 65 and older, or some younger people with disabilities. And as I said, Medicaid is based on financial need, while Medicare is based on an individual's work history and how much they have paid into the system. So that's Medicaid and Medicare. Now, unlike every other insurance affordability program, you can qualify for both Medicaid and Medicare. If you do, you're called dual eligible. You can be full dual eligible, in which case you have full Medicare and full Medicaid benefits. Or there are certain programs that we're going to talk about called Medicare savings programs. These are partial dual eligibles. They're Medicaid programs that help people pay the premiums and cost sharing that people have to pay for Medicare. But a full dual eligible has both. For dual eligibles, Medicaid is always going to be the secondary payer for anybody with any other insurance. There's no rule that you can't have Medicaid if you have other insurance, unlike Cover Kids and premium tax credits where you can't have other insurance. But when you do have Medicaid, it's always going to be the secondary payer if you have another insurance. So they're going to bill the first one, And if there's anything left over, then usually Medicaid will pay it. So applying for TennCare. Until January 1st, 2014, anybody in Tennessee could go to their county office of the Department of Human Services. They could bring their shoebox full of their pay stubs and bills and everything and sit down with somebody, a live person at a desk, and that person would help them apply. Since then, Tennessee requires everyone, with just 2 exceptions, or 3 exceptions, to apply through the federal marketplace. That's healthcare.gov or the FFM. Now, the federal marketplace was never intended to be the sole portal for Medicaid applications. There's several provisions in the Affordable Care Act that are called the no wrong door provisions that require state Medicaid programs to accept applications online, by phone, in person, and by other commonly available electronic means, such as a fax. Tennessee was going to do this, and we had a computer system called TEDS, which always brings to mind HAL from 2001: A Space Odyssey. TEDS, it was going to be built by Northrop Grumman, a defense contractor, and reminds me of HAL. Northrop Grumman, they're really good at missile systems and evading international arms control agreements, but less good at building Medicaid systems. So the computer system failed. And we don't have a state-level computer system to process Medicaid eligibility now. That's why we have to send everybody through the marketplace. There are 3 exceptions to this that we'll talk in much more detail about all of these, but there are presumptive eligibility, where people can go to the health department or some hospitals to get presumptive coverage, sort of temporary coverage, while they wait for their Medicaid application to be processed. And these presumptive eligibility programs often working through the Department of Health, or hospitals can do these as well. And for newborns, you can also just call TennCare's call center and report the birth and get presumptive eligibility that way. But you still then have to apply through the marketplace, and we'll talk about all of those later. The 2 places that you can apply directly to the state and not have to go through the marketplace at all are the Choices Program, which is our long-term services and supports program, which covers nursing facility care and home-based care at an equivalent level, people who would qualify for a nursing home but can be safely kept in their home with an array of home community-based services. And then the Medicare savings programs that I mentioned, these are programs that are administered by Medicaid but help people afford the cost of their Medicare plans. Both of those you can apply directly to the state and never have to go through the marketplace. Everything else, every other category, and you're going to see there's lots and lots of categories, everything else has to go through the marketplace, whether the marketplace screens for them or not. That's still where you have to start. Federal law requires that when someone puts in an application, they have to have a final determination of that application within 45 days. This became a problem a few years ago when, does everybody remember the rollout of the federal marketplace? Not smooth, pretty bad. During that time, everybody still had to apply for Medicaid through the marketplace. They were getting 6-month, 8-month delays. We had a federal court suit on that. There's some additional things about the application process and the timeliness of the processing that we'll talk about later. Now, TennCare, before there was TennCare, there was just something called Tennessee Medicaid. And Tennessee Medicaid was a fee-for-service system. Someone got a Tennessee Medicaid card, they went to their doctor took Medicaid, they got their services, the doctor billed the Medicaid program, and it was done. In 1994, this was the heyday of managed care. Everybody said there's lots of cost savings that could come if just a single entity could be in charge of managing the care. We could do away with duplicative services. We could focus on preventive care rather than sick care. So in 1994, TennCare was created by Governor Werder, and TennCare was a Medicaid managed care system. Now, there were little pieces of Medicaid managed care floating in the air, lots of people talking about, oh, we should move Medicaid to managed care, but Tennessee was really the first state to move their entire Medicaid population into managed care. And that means everybody on the program, rather than just getting a Medicaid card, they were actually enrolled in a private managed care contractor. You'll hear us probably several times in the course of the next 2 days talk about MCOs, managed care organizations. Everyone on TennCare is enrolled in a managed care organization. Then the state pays a capitation fee, a per member per month rate to the insurance company, to the MCO, and it's the job of the MCO then to manage the care. And if their enrollee, if they're able to manage the care and keep costs for that, the medical costs for that person below their capitation fee, well, that's their profit. If they get unlucky and there's someone really expensive, well, that's the risk they bear for being the MCOs. But one of the key things in this that's different from other Medicaid programs is closed networks. So Medicaid, there's a provision in federal law that says has free choice of providers. We have a waiver in Tennessee so that we can implement managed care with closed networks. So it's important for people to know what doctor their network is in when they're applying. If they have a preferred doctor, they need to find out which of the Medicaid MCOs their doctor is in, if any. And then every person is assigned a primary care provider by the MCO, and that primary care provider becomes sort of the key to unlocking everything else. That you go through a primary care provider, and they can then refer you to specialists. So for the people who you're automatically assigned to an MCO when you enroll. If your doctor is not in the MCO network that you're assigned to, you have 45 days free choice. You can just say, I don't want to be in this one, I want to be in that one. After 45 days, you have to show that there is a hardship. Most often this is going to be, there is a specialist who is in another MCO's network, and there is no equivalent specialist in my network. That's the primary reason for a hardship exemption. There are a few others, but that's the primary one. And then there are enrollment periods. Every year, you can also change your MCO during an open enrollment period without showing hardship. And it's different for each part of the state. Okay. There's lots of ways to think about how people are eligible. But the one we recommend is this basic four-step process to think through, is someone eligible? And the first one, and really the key one to think about is, I'll tell you a little story. I had a state senator who screamed at me in my face, like with his finger pointing at me, saying, everybody below poverty is eligible for TennCare. I said, respectfully, sir, that's not true. He told me I was lying to him, but everybody has to be in a category. Just because you qualify financially does not mean you're eligible. And there are categories such as children, pregnant women, parents and caretaker relatives, people with disabilities. Single adults are not the category that's covered. But once you qualify for a category, then you have to qualify financially. Then for some categories, there are also resource tests. So not just your monthly income, but how much you have in the bank. You know, do you have a vacation home? Do you have an IRA or some retirement plan? Money that's available to you can also make you ineligible for TennCare for some categories. Other categories do not have a resource test, notably the MAGI, or Modified Adjusted Gross Income categories that we will talk about. And then you have to apply, again, through the federal marketplace. In order to understand what household income is, you have to know who's in the household. Eligibility for all of these categories is based on household income. And so to figure that out, you have to know who is in the household and then what income counts. If somebody just gives them $10 on the street, is that income? Do they have to report that? What kinds of income count? So I'm going to talk about how you count household size, which is surprisingly complicated. You think, oh, it's just the people who live in my house, right? No, that's not what it is. And then Rob is going to talk about what counts as income, what kinds of money coming in are going to count towards your eligibility. Now, a few basic principles in household size counting. First of all, household counting is always an individual determination. You have to look and say, okay, whose eligibility am I trying to determine? And what is that person's household size? And this is complicated because people can live within the same 4 walls with the same people and have different household sizes. There's also different household counting rules for different categories of TennCare. And then rules differ depending on tax filing status. So all of those are variables that can play into this, but we're going to go through step by step in how you do this. So the 3 main categories of household counting rules are the MAGI categories, or modified adjusted gross income categories. Who can tell me quickly the 3 MAGI categories? Parents and caretaker relatives? Children. Pregnant women. Those are the 3 MAGI categories. And these are the basic categories that use a special new kind of income counting rules that are also applicable, these kinds of income counting rules, for premium tax credits. And the reason this was created and the income rules were changed is so that there would be a seamless way to figure out income across the basic Medicaid categories as well as premium tax credits. They're based on IRS rules because premium tax credits are awarded through the tax system. And so you have to figure out through these tax rules if you're eligible for premium tax credits, and to ensure that there were no overlaps or gaps with Medicaid, they changed the basic counting rules to the MAGI rules for Medicaid as well. And then there's medically needy spend down, and then what TennCare now refers to as the aged, blind, disabled categories. So we'll go through household counting rules, the MAGI ones in detail, and just point out a few differences for the medically needy spend down and the aged, blind, disabled category. Already said MAGI, modified adjusted gross income. It's premium tax credits, cover kids also uses MAGI, and then children, pregnant women, parents and caretaker relatives. The first question to ask if you are trying to figure out what is this person's household size is ask, what is their expected tax filing status? And you're always talking about what is the next time taxes come due. What do they intend to do? And there are only 3 choices. They are either going to be a tax filer who is not claimed as a dependent. They could be a tax dependent, and tax dependents can also file taxes, but if they're, let's say you've got a teenager with a summer job who just wants to get the refund, they can be a tax filer, but if they're claimed as a dependent, their tax filing status is tax dependent. So the tax filer is not claimed as a dependent. Tax dependents, and then non-filers, non-dependents, people who just don't file taxes, nobody claims them. So those are the 3 categories. Everybody is going to be one of those things, and that's the first thing you have to figure out. Now, you got the 3 possible tax filing statuses, and then there are 2 ways to count the household. They're just 2 different ways, and the question is always going to be, which of the 2 ways of counting the household do I use for each category? And the 2 rules I call the tax filing unit rule, and then the parents, minor children, minor siblings living together. Those are the 2 rules. I'll go through in more detail what they are. So quickly, when we talk about children, since we were just talking about, for counting household size, children means a child must be under 19, and this is for the marketplace, they have to be under 19 or under 24 and a full-time student to be considered a child for purposes of including them in a household for figuring out household size. Note, the rules are different for your category. Just because you count in a household does not mean you qualify as a child for purposes of your categorical eligibility. This is just figuring out whose income counts in the household and how big the household is. For TennCare, it's under 19 or a full-time student under 21. And just to point out some differences, For the categorical eligibility, children under 19 are children for purposes of counting, but there is no full-time student rule for the categorical eligibility. And then for medically needy spin down, a child is under 21. So there's differences just to keep things interesting, to keep everybody on your toes. All the rules are always different for everything. And when you're talking about somebody between 18 and 21 or 24, you're going to have to look at the toolkit to figure out what their age means. So for premium tax credits, they're awarded through the tax code. So there's only one way to count a household if it's awarded through the tax code, and that is the tax filing unit. Tax filing unit is always going to be the household size for premium tax credits. And this can include, based on IRS rules, includes family members or unrelated people who are claimed as tax dependents. So you can have grandchildren, nieces, taxpayers' parents, other people. If they can be claimed on the taxes, then they're part of your tax filing unit. The tax filing unit is up to the IRS, but as to who you can claim. But the tax filing unit, for your household size, is going to be that tax filing unit. So how many of you, everybody who's been here before knows we do this, but how many of you have ever seen the show Nashville? We've figured out that since it's sort of a soap opera, it's set in Nashville, lots of people are getting divorced and remarried and their kids are yours, mine, and ours, that it was good scenarios for figuring out household sizes because it's all as complicated as the relationships on Nashville. So for premium tax credits, let's say Deacon, Raina, and Maddie, Deacon and Raina file joint tax return. They claim Maddie on their taxes, household of 3. Easy. Tax filing unit's always the easy one. You just say, who's on the tax return? 4, I forgot. Oh, Daphne is over there with 1 or 2. Now, the other rule for TennCare, the tax filer, if someone is a tax filer, remember the first question is, what's the expected tax filing status? The tax filer, that person's household is also always going to be the tax filing unit for TennCare. Premium tax credits, for everybody, it's the tax filing unit. For TennCare, for the tax filer, their household is the tax filing unit. So for tax filers, the rule is always the same, the unit. Now let's go to the other end of the spectrum, the non-filer, non-dependents. Their household is always going to be parents, minor children, and minor siblings living together. So a child, it's going to be, if they have minor siblings plus their parents. For the adults, it'll be their spouse and any minor children that they live with. And this is that they live with. Okay. So there's 2 rules and 2 tax filing statuses. You've got tax filers, it's always going to be the tax filing unit. Non-filers, non-dependents, it's always going to be the household size, the parents, siblings, spouses, minor children, minor siblings living together. Now, it only gets complicated when you talk about tax dependents, people who are claimed as a dependent on someone else's taxes. Now, for tax dependents, the baseline rule is the tax filing unit. So most tax dependents are still going to be in the tax filing unit. That is, whatever tax return they're claimed on, however many people are on that tax return, that's their household size. But there are 3 exceptions. If the tax dependent is not the minor child or spouse of the tax filer, then you don't use the tax filing unit. You go to the household, parents, spouses, minor children, minor siblings living together. Second exception. The tax dependent is a minor child living with both parents who are unmarried. And this is, I keep meaning to change this. The important thing is not that they're unmarried, but the parents can't file a joint tax return. If you've got parents who don't file a joint tax return. Little footnote here. Spouses, to get premium tax credits, what do they always have to do? They have to file joint. You cannot, if you're married, you cannot get premium tax credits if you file individual tax returns. You have to file a joint tax return. If they don't, then the minor child, who would still be eligible for TennCare, you don't look at the tax filing unit, you look at the parents, spouse, minor child, minor sibling living together. And the third exception is the tax dependent who is claimed as a tax dependent by a non-custodial parent. So let's say parents get divorced, dad lives by himself, but he claims the child on his taxes, then you look to that household rule, the parents, children living together. And I'm going to give you scenarios on these, so we'll work through them. Gunner, country wannabe, Gunner Scott, he lives alone, of course. He's not claimed as a tax dependent on anyone else's tax returns, and he has no tax dependents. What's his household size? Easy enough. Shout it out. 1. He's in a household of 1. Now, country legend Raina James, her husband, mayor of Nashville, Teddy Conrad, their 2 kids, Maddie and Daphne. They're married. They file a joint tax return. They all live together. What is everybody's household size? They're all 4. This is all tax filing unit. There's no exceptions here. The tax dependents, who are Maddie and Daphne, none of those 3 exceptions apply to them here because they live with the people who are their parents who are claiming them on the tax returns. All right, now let's throw in some wrinkles. Teddy and Raina get a divorce. Raina lives with Maddie and Daphne. Teddy, who lives alone, claims Maddie and Daphne on his tax returns. What is Raina's household size for TennCare? So the first question is, what's her status? What's her tax filing status? She's a tax filer. What's the rule for tax filers? Their household is always the tax filing unit. She's not claiming the kids on her tax return. Teddy's claiming on his tax returns. So what's her household size? 1. Household of 1. Now, Maddie and Daphne, they are, Teddy is claiming them, but he's a non-custodial parent. So not just what's the household size, but who's in the household. So I heard 3. You're correct on 3, but who's in the household? How many people think it's Teddy, Maddie, and Daphne? How many people think it's Raina, Maddie, and Daphne? If they're claimed by a non-custodial parent, this is one of the exceptions. So you don't look to the tax filing unit. You look to the parents, spouses, siblings living together. In that case, the parents, spouses, siblings living together with Maddie and Daphne are Raina, Maddie, and Daphne. Teddy, you don't count them in Teddy's household because this is the exception to the tax filing unit. Oh, didn't mean to do that. Teddy's household, though, Teddy is still a tax filer, so the rule applies to him that his tax filing unit is his household size because he's a tax filer. The rule is always the same for the tax filers. So you have an interesting situation here where, for purposes of Maddie and Daphne's eligibility, their household size is 3 and Raina is in the household. So from their perspective, from their household size, Teddy is not in the household. But from Teddy's perspective, Maddie and Daphne are in his household. So he's in the household of three, including Maddie and Daphne. Maddie and Daphne are in a household of 3 that Teddy's not in. This is one of those things where you get different people with different household sizes all living together. Now let's even make it more complicated. Let's say as part of Teddy and Raina's divorce agreement, they each get to claim a child on their tax returns. So Raina claims Maddie, Teddy claims Daphne, but both kids still live with Raina. What is Raina's household size and who's in it? Raina is what? What's her tax filing? She's a tax filer. The rule's always the same. How many people? She's only claiming one of the kids. Raina's only claiming Maddie. It's 2. It's her tax filing unit, Raina and Maddie. That's the household size. 2. Maddie. So what's her household size? Maddie is being claimed by her mom that she lives with. Do any exceptions apply? Can you speak louder? There's no exceptions apply. She lives with her mom, who is claiming her on her taxes. She's not being claimed by a non-custodial parent. Her parents aren't married. It is her mom who's claiming her. So it's the tax filing unit for Maddie as well. Now what about Daphne? Teddy is claiming Daphne. So what's her household size? And who is it? So the tax filing unit for Daphne is Daphne and Teddy. But we're looking at an exception to the tax filing unit because he's a non-custodial parent. So we look not to Teddy, but we look to who she's living with. In her case, she's living with a parent and a sibling and herself. So she is in a household of 3. So in an odd situation here where because of tax filing status, you've got 2 siblings who appear to be in the same, would seem to have the same household size, but they don't because one is claimed by a non-custodial parent, so the exception applies. And this could be an odd situation depending on household size where on household income, where one child could be eligible for TennCare because the household size is larger, but the other child would only be eligible for Cover Kids because her household size is 2, and the income level for a household of 3 is going to be higher than for a household of 2. Okay, what's Teddy's household? 2, and who are they? Filing unit. It's the same old rule. Okay, Juliet Barnes. Up-and-coming country star Juliet Barnes, but she's had a scandal. She's had a child out of wedlock, Cadence. And her mom, Jolene, lives with her. So you have a 3-generation household. You've got Jolene. So let's think of generations, like the grandmother generation, Jolene, then the mom, Juliet, and then the child, Cadence. They all live together. Juliet claims both Jolene and Cadence on her taxes. What is Juliet's household size? 3. She's a tax filer. The answer is always going to be easy for the tax filer. What about Jolene? So first, do we use the tax filing unit for her? Why not? What's the exception that we're using for Jolene? She's not being claimed by a parent or spouse. And that's the first exception, is if you're not being claimed by a parent or spouse, you don't go to the tax filing unit. You go to that's one of the exceptions, and you go to the parents' minor children, minor siblings living together. And I just gave you a hint as to what her household size was. Who thinks 1? Who thinks 3? Anybody think 2? She's in a household of 1. So you're not looking at the tax filing unit. So you go to the exception, and then you look at parents, minor children, and minor siblings and spouses living together. She doesn't live with her parent. She doesn't live with a minor child or a minor sibling. She's a household of 1. Oh, keep giving it away. Okay, so tell me why. Why is Cadence in a household of 3? What's her status? So her status is a tax dependent. Are there any exceptions that apply? She's being claimed by her parent. So you look at her tax filing unit, and that is 3. Household of 3 there. All clear? At some point, for those of you who are new to this, all this just clicks, and you just can look, and it becomes like a beautiful mind kind of stuff. So that's the Magi categories. All those rules only apply to Magi. Remember, there's lots of other categories of TennCare. And the same Magi rules also apply to premium tax credits, except it's always the household, the tax filing unit for premium tax credits. Now for medically needy spend down, there's a few differences. First big difference is children whose household counting rules for medically needy spend down are under 21, not under 19. So that's one big difference. Second difference, step parents and step siblings do not count in the household for medically needy spend down. And we'll talk, medically needy spend down is a sort of special category that nothing else works like medically needy spend down. But for now, just remember the name and that the household counting rules are different. The other big difference is most of the time, for most Magi categories, a pregnant woman counts, always is going to count. If she's going to give birth to one child, she is always a household of 2. But for everybody else in the household, she is one person. So for example, let's say you have mom, dad, and 3-year-old, and mom's pregnant. No exceptions apply. You're just looking at the household. That's a household for the 3-year-old. It's a household of 3. For dad, it's a household of 3. For mom, it's a household of 4. So the unborn child is always going to be in the mom's household, but nobody else in the household, except in medically needy spend down. They who will become the applicant's siblings do count for purposes of medically needy spend down. So those are the big exceptions there. So for pregnant women, medically needy spend down. Now last, aged, blind, disabled categories. Now there's several of these and lots of them are really complicated. Most of them are, we think of them as the SSI related categories. SSI is supplemental security income. Note, this is not, SSI is not SSDI. This is one of those things like Medicare and Medicaid that people often get confused. SSI, supplemental security income, SSDI, Social Security disability income. SSI is means tested. It's not based on work history or paying into the system in the past. It's solely based on income now and having a disability. But there's lots of related categories that you're going to hear a lot about. Other ABD categories, choices, the long-term care program, institutionalized TennCare, hospice care, and the Medicare savings programs. These are all ultimately based on the SSI counting rules, the household counting rules for SSI. If you ever want to just really go down a rabbit hole, try to trace the household counting rules from the Medicaid regulations and statute through, because it all ends up going through the old AFDC rules that don't apply, don't really exist anymore except for as supplements to other acts, and then refer separately to the Social Security Act and the SSI rules. It's crazy. It is the craziest thing you've ever seen. And it's very hard to figure out. But for these categories, there are only 2 possible household sizes. It is either 1 or 2. There are no households of 3 for these ABD categories. There are questions as to other people whose income is going to count toward you, but that's not part of household size. This is because of these complicated rules about can someone else's income be deemed to you, but we're not talking about that now. So household is 1 or 2. It is most often going to be 1 unless you've got a married couple where both partners are eligible for Medicaid and living together. That's a household of 2. Or I think I may have gotten this rule wrong, but it's important. The important exception is if they're married couples living together and both spouses are eligible for Medicaid, they're a household of 2. In almost every other situation, it's going to be a household of 1. There may be other people whose income counts, but it's not going to increase the household size. That's the key point to remember. It's not going to increase the household sizes. Can only be 1 or 2. I messed up. Okay, it's important to remember that any change in the household composition has to be reported and can affect the amount, either whether someone is eligible or what program they're eligible for. And these are things like birth, adopting a child, marriage, divorce, separation, death of a family member no longer eligible to be claimed as a tax dependent, or a minor child turning 18, or as you saw in some other things, turning 19 or 21 or 24. So a child who is no longer eligible to be claimed as a child. All of those things have to be reported. They can be reported for premium tax credits. They're reported to the marketplace, the federal marketplace. In other situations for TennCare, they're reported to Tennessee Health Connection, the TennCare call center. And just call, tell them, I gave birth, here's my child's name, and it's done. Again, married couples who file jointly, or who want to get premium tax credits, they have to file a joint tax return. Yeah, married and spouses who live together are always going to be in each other's household, with the exception of that SSI related category that I was talking about. And here's the rule I was talking about. Pregnant women, for the marketplace, can you claim, if you're pregnant and you're single, how many people can you claim on your tax return? One. For the marketplace, a pregnant woman is one, always. You can't claim a child that's not born on your tax returns. For the Magi categories, for the pregnant woman, it's her plus the number of children she expects to give birth to. So she's going to have triplets. She's a household of 4. You get suddenly eligible for a lot of things if you're suddenly a household of 4. And then for medically needy spend down, that unborn child is in the household of everybody else in the household. Questions? Surely there's some questions. Yes?
Do common law marriages count as a married couple under TennCare?
Do common? I don't think we recognize common law marriages in Tennessee. Yeah, so that would not be applicable. Anyway, some states do, and I think out of there would be laws that would say we would have to recognize a common law marriage from another state, but generally no. Question, and the question there was, do common law marriages count? And we don't have common law marriage in Tennessee. Here's a question from the webinar. During enrollment periods for TennCare, is it a request, or if a person contacts TennCare Solutions during their enrollment period? I don't understand this question. Their enrollment period will actually be... Can you ask the question? Yeah, I can't quite figure out what it says.
During enrollment periods for TennCare, is it a request, or if a person contacts TennCare Solutions during their enrollment period, will they actually be switched to whatever MCO they request? This was asked back when we were showing the slides about it.
Okay, I think the question, I'm still not sure I understand the question, but let me just mention the enrollment, the MCO changes again. If you're within that first 45 days, you've been notified that you're enrolled in Blue Care, one of the MCOs, and your specialist, some specialist that you want to see is not in Blue Care, you can put in a request within 45 days to be switched to another MCO that is in network. You can say, I want to be in United Health. And you don't have to show, you don't have to prove anything. TennCare will switch you within that first 45-day period. Outside that, you have to show hardship. I think that addresses the question.
And we have another question also related to changing MCOs. It says enrollment periods. West is March, middle is May, east is July. What does this mean?
So for MCOs, and I actually think this may be outdated. I have not looked at it. Until last year, the state was divided into 3 regions, the 3 grand divisions of the state, east, middle, west, and different MCOs operated in different regions. Last year, we switched to a statewide MCO, that all the MCOs operate statewide. But I still think, I'll have to double check this. What this means, though, is if you live in the East, you have a different open enrollment period than if you live in the West or the middle. That every year, if you have your open enrollment period, your first 45 days, then you can't change without proving hardship until the next open enrollment period, which are those months. Maintain those differences for different divisions of the state, because the MCOs probably don't want us to open up the entire state at the same time in all regions. Yes, Andy.
45 days, when does that start to molt? Date of the date that eligibility is determined. So the date the coverage starts, or the date of application?
There are situations, okay, the question is, when does the 45-day period for changing MCO start? Is it the effective date of your coverage, the date of application? It is not going to be the effective date of coverage, because you could be outside the 45-day period already when you find out when your coverage started. So some people can apply, and remember, you have to have, TennCare has to give you an eligibility determination within 45 days of your application. But if you're on the 45th day and then you get your notice that says, congratulations, you're eligible, that would use up your entire 45 days to change MCOs. What happens is, when you're found eligible, you get a welcome to TennCare packet. You get a packet sent to you that says, welcome to TennCare, here's your MCO, here's what you need to know about your MCO, here's your provider list, all of those things. The date of that welcome to TennCare package, I am almost certain, is the date that starts that 45-day period running. It is from the date you are assigned to an MCO. You have 45 days, and they send out that notice when you're assigned. So at that point, so when you get the welcome to TennCare packet, or when your clients get the welcome to TennCare packet, they've got 45 days from the date on that packet to request an MCO change, and they can do that without having to prove anything. They just request the change. Other questions? Another question. Other questions here? Yes.
Yeah, so I have a question. After the 45 days and take my short MCO, after the 45 days if they want to change the MCO, what counts as a hardship? I mean, I'm assuming that would be more than just a financial hardship.
It is most definitely not financial hardship. Hardship is, there are, oh, I'm sorry, I thought with the microphone should get. It's what counts as a hardship for purposes of being able to change MCOs outside the 45-day window. Almost always the main hardship is going to be that there is a specialist that you need. Let's say you need a nephrologist, and there is not a nephrologist in your network. Then you can request a hardship exemption to change MCOs. Now, in this situation, there are actually two different things you could do. If there's a specialist that's out of network, and that's not in your MCO network, one thing you can do is to request prior authorization from the MCO to see an out-of-network specialist. That could be authorized, and they can just say, okay, fine, we'll let you see that doctor and pay their out-of-network rate. The other thing that you can do is request the hardship waiver and say, I'm sorry, you do not have an equivalent specialist in your network, so I need to change. If you get, and one important thing to remember here is if TennCare denies that request to change MCOs, that is an appealable issue. They have to give you a hearing. They cannot just say, no, we have an equivalent specialist in our network. You have a right to challenge whether the in-network specialist is actually the specialist you need. Now, if it's just, oh, I need a cardiologist and I really like this other cardiologist and I don't like your cardiologist, that's not a hardship. You have to show that the care that I need, the specialty care that I need, is not available in network. And that will prove hardship for purposes of being able to shift MCOs outside open enrollment for the first 45 days. Yes?
We have a case ongoing right now where two parents were deceased. So two parents were deceased, both had cancer, died within a month of each other, with 3 children. The grandparents have come to take care of the children. but they do not claim them on their taxes yet. There's still ongoing custody issues. When going through healthcare.gov, it was the non-custodial grandparents, they were asking for their income, and so it's hung up in healthcare.gov right now. How will the grandparents' income affect the 3 children's ability to get on TennCare right now?
So the question, it's a complicated household situation where grandparents have, parents, what happened to parents? Parents, they both parents died of cancer. Grandparents have come in. The children don't live with.
The grandparents, 2 sets of grandparents are taking turns taking care of the children instead of elderly. So they're leaving.
Okay, the 2 sets of grandparents are each taking care of the children. And it's what do you do in this situation? Who counts in the household? Now, first of all, you still have to just go back to the rules and look. First of all, where are the kids living? And that question is simply a majority of the time. Where do they spend most nights of the year? So for their eligibility, whichever household they spend most nights of the year in is their household. So in this situation, it could be complicated if it's random. This is probably something, I'll tell you the real answer to this is whatever happens, unless the kids just keep TennCare and nothing happens, this is probably something that you're going to have to appeal and go before an administrative judge to show, because the automated system can't take into account the sort of chaotic nature of a situation like that. If it's hung up in the automated system, after 45 days, you can appeal that, and you can file a delay appeal. This is something that's required by the Wilson versus Gordon lawsuit that requires TennCare to offer hearings if someone has put in an application and they don't have results in 45 days. TennCare has to offer them a fair hearing. What's actually happening is if someone files a delay appeal, TennCare simply makes sure that you get results within the next 45 days so that they're not actually holding these hearings. They're determining results within the next 45 days. At that point, whatever the result is, if it turns out they're decided not eligible or something is wrong, that then becomes an eligibility appeal. So this is unfortunately a situation that could require 2 separate appeals in order to get it resolved. But what is most likely going to happen is you're going to have to sit, either the family or some representative is going to have to go before an administrative judge and show, okay, here's a calendar, here's where the kids spend the most nights, and that will become their household for purposes of income counting. But if you want help with that, please just come to us and we can help navigate it for the family. I hope there aren't a ton of situations like that, but it does sound very chaotic and confusing. Yes?
Hey, Chris, I've got a comment and then a question, and this is regarding the age-minded disabled category. My understanding with, this is the comment with the Medicare Savings Program is that you are supposed to determine household size based on what is to the best advantage of the household. And that's for households that have minor children. So for a household where parents are, together, they're married, and they have 3 children, and they're all minor, if it is to their advantage to have that be a 5-person household size, then you do count any income that the children may have, mostly being child benefits and Social Security would be a common, benefit. But you can do it that way, or you can just count household size of 2, and then you wouldn't count the children's income. That's the way I've been taught. I don't know if you know for sure that's wrong, or...
Well, the background and confusing principle is for a long time, states and beneficiaries and the feds have been confused by the household accounting rules for SSI, because what the Medicaid regulations say, use the household accounting rules for SSI, and those get really complicated, but then there are lots of exceptions in it. And what CMS finally decided to do is they put out policy guidance, I think in the late 90s, that said whatever a state wants to do, that's the EA can do it, as long as it's a reasonable way of counting household size.
Well, in Tennessee, they do that. They compare to see which is going to be more advantageous. I mean, I've had a household of 5 be able to qualify for community, the parent that was getting disability.
Yeah, I mean, I think this is a situation where the actual published rules that don't reflect that, but what actually goes on in practice, because the rules,
I'll agree with
if you
that.
chase them through down the rabbit hole to their source, there can only be a household of 1 or 2. But I've seen where it says, but if it's more beneficial, you can do this or that. I really think this is something, just know that there is some flexibility in the rules for these categories, and if you have problems getting somebody on, give us a call and we'll see if we can make the household size bigger.
There's kids in the family, especially. Yeah. The other thing is choices. Are you saying that with any of the choices waivers that you apply SSI income rules, meaning you only count essentially half of any earned income that an adult is making?
Well, the counting rules for income for choices is a whole big can of worms that I was deliberately leaving it at this.
Because that's something we do, and I thought, boy, if he's saying you only count half, I've been doing
No, I'm not saying you're only counting half. So the choices income rules can be really complicated because you're often talking about a community spouse. If someone's getting nursing home care, you've got one spouse still in the community, one in the nursing home, and that we'll do a separate training on choices rules at some point. I think there's going to be a little bit on it, but it's bigger than this topic. Anything else? All right, thank you. Rob is now going to talk about how to count income. What income is going to count?
Okay, are we having fun yet? All right, so my name is Rob Watkins. I'm one of the staff attorneys, and I'm going to give you a little quick infomercial coming up. So if you've been to the trainings in the past, you might have heard us talk a little bit about a tool that we're creating. It's called Ask Jane, and it's actually named after Jane Beasley, who's a retired client advocate at the Tennessee Justice Center. And the interesting thing was, if you ever had a question about Medicaid or Medicare savings programs, counting households, what income might count, you go and ask Jane, and she would have the answer. So what we've done over the course of the past 2 years is take all these complicated rules, like we have for household counting, and we've turned it into, for lack of a better term, an application that will work. It's actually being built on the Salesforce platform. It's something that if you think you might be interested in doing, it will actually count households for you. It will actually count income for you. And it will actually systematically screen people for public health benefit eligibility. So for example, if you're dealing with disability-related categories, it'll actually screen approximately 12 of those, and it is all at premium tax credits. So I think this is something you might be interested in. Shoot me an email. My email address is up here. We'll be talking more about this a little bit later on. But we're really excited because it's going to take a lot of these income counting rules and household counting rules and make it a lot easier for people who work with clients, especially trying to determine their eligibility. We're going to talk about income. All right, so let's try to stay awake. I'm going to hopefully move through this pretty quick. There are identified about 122 or 23 different income categories that are identified in one of the TennCare manuals. We're going to go over all 122 real quick. Just kidding, we're not. Okay? I'm just going to hit some of the important parts. Okay, so what I really want you to do is just kind of take this in a little bit and say, I remember going to this training and I remember somebody talking about how child support is counted when it comes to a non-Magi category. Maybe that's something I'd better look at. So a lot of this is just going to be kind of red flag stuff for you to kind of think about. But why is it that we have to really determine income? And that's because we're going to take the household, and Chris gave us all the rules for counting households, right? So once we know the household size, we can convert that, in most cases, using the federal poverty level, and we're going to determine what those income thresholds are to see if an applicant is eligible. So for example, here you see some of the commonly used categories that are up there. So for example, newborns, 200% of FPL, and then we would kind of come down across. If it's a household of 4, and we know it's 48,600. So when you think of income, what I always like to tell people, and going back to my federal income tax class I had in law school back in the 80s, was basically income's considered taxable derived from whatever source. So what does that mean for you? So as a starting point, when you're working with somebody, you need to think about what is every possible method of income that they could receive. That doesn't mean every part of it's going to be counted. It just means that we want to make sure we collect it all so we're not overlooking it. Because I might ask somebody, what do you consider income? And I might get an answer, and I might ask somebody in the third row, what do you consider income? And I might get a different answer. So it's all different things. But if you start with the idea that it's just really going to be everything unless the tax code says it's not, we're really talking about Magi here, that's a great starting point, okay? So whether it's energy assistance, whether it's food stamps, anything like that, one person might consider that income. It doesn't mean we're going to count it, but it might be considered income to one person. You might talk to somebody about child support. You might say, you know what, that's really not income. Well, if you start by collecting all these sources, then we can kind of figure that out. So when you take money in, it's going to be considered taxable income unless the code says it's not. And right now we're dealing with Magi categories, and I'm going to talk about how we get those calculations. So as Chris mentioned, when we talk about Magi, I always like to think of it as families. So parent, caretaker relatives, we're also thinking about pregnant women, and we're also thinking about kids. So chances are it's probably going to fall into a Magi category, or modified adjusted gross income. Of course, what is the rule if you don't have an exception, and that exception is medically needy spend down for pregnant women and children. So that's going to be something we'll talk about a little bit later. So how do we get there? If you file taxes, if you've ever filled out your own tax return, back in the old days when it was paper, we really start out with gross income, so we're going to collect all this different income. Then we're going to subtract what we call above-the-line deductions, and then we're going to end up adding back in 3 things, and that's going to give us modified adjusted gross income. So the first part is to talk about gross income. And when we think about income, it can come a couple of different ways. You can have earned income and you can have unearned income. And when we talk about earned income, we're talking about stuff like wages, salaries, tips, stuff that the person will typically get a W-2 for. And then we also have what we call self-employment or business farm income, or they might be an independent contractor. They might get what they call a 1099. So a lot of times to figure out, if someone says they work for somebody, an easy question might be, do you get a W-2, where those actual taxes are being withheld, or are you getting a 1099? If they're getting a 1099, chances are it's self-employment income. And that's important because you're going to be able to, if it's self-employment, or you have your own business, something along those lines, there's going to be certain expenses you're going to be able to deduct against that. So it's always kind of good to know that. If it's W-2, you're not. And then we have unearned income. So unearned income is going to be stuff like investments. So it could be dividends and interest. It could be capital gains or other gains. Let's say you had some stock and you sold it and you made a little money on it. It could be Social Security income, the amount that's taxable. We're going to talk more about Social Security income here in a minute. It can be retirement. So you're getting an IRA or a pension distribution. Sometimes income tax refunds. We really don't have income tax in Tennessee, but I used to live in Illinois. We have income tax there. So if you get a refund, you get what they call a 1099-G. It shows how much that they credit for that. Alimony received, it's really important because alimony that's received is going to be income to the person that gets it, and the person that pays it's going to be able to deduct it. Income from real estate, unemployment compensation. Then let's say you go to the gambling boat and you hit a slot for $5,000. So there's other ways, prizes, things like that you can get and be considered under an income. Now I will mention the reason why we break income down into earned and unearned is really going to come into play when we start dealing with tax dependents and to a certain extent what amount is actually considered taxable Social Security. In those instances we would need to separate out what that income is. And I'm going to go into a little more detail of that later, but just kind of park that in the back of your mind as to why we're actually segregating these earned and unearned. So once we collect all this income, right, we've checked every little source where they might be getting it. Now we get to subtract off the deductions, what we call above the line deductions. And there are several here. This is taken from the 1040 form. And you'll see quite a few of them that are listed here. The ones I really want to point out to you, alimony paid, which is line 31A. Obviously, this recipient's Social Security number has to be put in there. But basically, what happens is you paying the alimony to somebody, you're going to get deducted. Here's where it's going to come off of your income. Whether or not you decide to itemize or not, it's going to come off here. Then it's going to be actually considered income to the recipient. Tuitions and fees, if you get somebody that happens to move, so just be aware that there's several things here. Now I'm going to give you a handy tool to maybe bookmark on your web browser. That's IRS Publication 17. It's called Your Federal Income Tax. Harkening back to my days when I was in law school, we had federal income taxation. Interesting thing was right after the passage of the Tax Reform Act of '86, and we didn't have a book. But every year the IRS puts out this nice, real thick booklet called Your Federal Income Tax Publication 17. And the nice thing about that is it's written in layman's terms or non-lawyer terms. And it pretty much addresses everything that you might have a question about. So it'll talk about each one of these. It'll talk about what is considered income. It'll tell you what things have changed for this particular tax year. It usually starts it out. It's a very, very big publication. It's not one that you want to print out and have, but rather bookmark it so you can search it. So if you're not really sure about how the tax code is going to consider something, you can go to IRS Publication 17, and chances are you're going to get the answer that you're looking for. If you still don't understand it after reading that, then that's something you can talk to us about. We can do our best to figure it out. But in most cases, it'll answer about everything that you need. So we take these above the line deductions, and now we're going to get ourselves to modified adjusted gross income, which means we're going to add back foreign income, tax-exempt interest, and non-taxable Social Security benefits. All right. So once again, we're going to talk a little more detail about those. Remember when Chris was talking about we really kind of need to know tax filing status, you know, who the tax filer is and whether or not a tax dependent. Tax dependents are once again going to be the exceptions to the rules that we're going to be looking at. Which takes us to special rules for tax dependents. Okay, so for Magi, all right, we've got our household. And we counted those people. Now everybody that's in the household, we now got to consider what their income is and what's going to count for their income. And then once we have that information, we're going to measure that against the threshold, the income threshold, which in most cases is going to be matched against some percentage of the federal poverty line. Right? So it's the sum of every individual in the household, except income of tax dependents that are not required to file taxes. Okay, now, here's where it gets interesting. A lot of times you will have a common situation, and Chris mentioned it earlier, is you might have a family and we've got a child that has a part-time job, right? Now, they may decide, because they're getting W-2 wages, they may decide, you know what, I want to file a tax return because I want to get my refund back. I'm going to get back those, all that withholding that came out of my check. I want to be able to get that back. So they may file a tax return, even though they're not required to file a tax return, okay? So you can't just ask, does the tax dependent file? Just whether they're required to file, right? Difference. Now, I mentioned earlier, we need to know in some instances whether it's earned income or unearned income, and this is where it comes into play, all right? So if it's earned income, then it's about $6,300 a year is what they can have in wages before they are required to file taxes, all right? If you have a kid, has a part-time job, let's say he makes $6,000 a year, and no other source of income with it, he would not be required to file taxes, so we're not going to count that in the household. He's not required to file, his income would be zero. Now, he's still part of the household counting, it's just we're not going to count any of his income, all right? Unearned income. Now it drops a lot. It drops down to $1,050. So if they have unearned income, let's say they're getting interest, or let's say they're getting money from a royalty, let's say maybe it's on music or whatever. Now we're going to roll this down to the $1,050 limit. So if you're over $1,050, you'll be required to file. All right? So the big question becomes what happens when you have both. And all I can really tell you is it's complicated. The best thing to do is IRS Publication 929 has very helpful worksheets in it. Instead of trying to explain it to you today, it's just easy to go in there and step by step, just fill it out and you'll figure out whether or not they're required to file. But just in general terms, probably for most of the people we'll be working with, they're probably not going to have unearned income. If they're working, it's probably $6,300. Now, there are going to be certain instances where there's going to be automatic filing required, okay? And some church wages, it's very, very low amount, or self-employment. And once again, an underlined up here is net earnings of $400 or more. So somebody has a part-time job or side business. So we have a dependent that either babysits or mows yards, or let's say we do car detailing or whatever, it's going to be net earnings, all right? So we get to subtract off those expenses. Ordinary and customary business expenses, we get to subtract that off. So for example, car detailing business, we might want to subtract out the supplies that we have. So you just want to remember, you want to subtract off some of those expenses so you get down below that 400. Because if it's over 4, then it's going to trigger an automatic tax filing. The other thing might pop up would be uncollected Medicare taxes, and that's the main thing. So all these things are really geared to catch situations where maybe an employer, or if somebody's got a job on their own, or business, side business that they're working, they want to make sure they're collecting those Medicare taxes. And these are things that will automatically trigger a tax filing requirement, and it doesn't matter how much that income is. So you got a kid, he has net earnings of $1,000, even though it's lower than the $6,300 threshold, he would be required to file. So let's have a little fun with practice problem here. So back to Nashville, let's say Maddie and Daphne make a little over $3,000 each playing at an award show. Is this income going to be part of the household's magi? Let's assume that they're a household of 3. How many people think that income is going to count? That $6,100 is going to count towards the household? Show of hands, don't be afraid. Nobody thinks it's going to count. Okay. How many think that this $3,050, none of it's going to count? Now, come on. I see like 5 hands. It's okay. How many people think it's going to require more information? Okay. We need more information. Now, why is it that we need more information? Well, we didn't tell you in this example how they got paid. Is this a 1099? Could this maybe be considered an independent contractor? In most cases, probably would be. Or are they actually getting a W-2? So is this going to be something that's going to be over that $400 limit? We'd have to look at what those expenses are. Maybe they get to deduct some of that. Maybe it's lessons. Maybe it's equipment. All those types of things. We might be able to get that down below it so it doesn't count. We'd also need to know what other sources of income do they have. You know, are they playing at other award shows, for example? Do they have other wages? Do they have interest or whatever, something like that, or money that they're receiving as unearned income that would affect it? So bottom line is, when you see somebody that might have a side job or a 1099 they might get, just remember to ask some follow-up questions about what they might have. So let's talk about some income, what I call gray areas, all right? So we field questions a lot of times, and a lot of it comes out, what about this government benefit? Once again, we're talking about MAGI here. So the general rule is if the benefit is based on need, then it's not going to be taxable. And if you think about it this way, all right, so what the government doesn't want to do is give you more income in a benefit that would be taxable and then hope that you file taxes and pay the tax on that. A lot easier if we just reduce that benefit and not make any of it subject to income tax, right? That's kind of a little rationale behind it. So once again, MAGI, we're talking, if its benefit is based on need, it's not going to be taxable. So what are some of these things that will not be taxable that you're likely to come across? Supplemental security income, or SSI, right? That is based on need. Someone with a disability, right, is very, very low income, right? That's supplemental security income, SSI. It's based on need. Not going to count it. Veterans benefits are a little bit more dicey here. If it's based on need and not based on hours or years of service or retirement pay, then that portion we're not going to count, right? But if it is based on maybe retirement pay, then that portion will be. And I believe, I'm not an expert on veterans benefits, but sometimes those kind of get lumped together. And you're going to have to be able to somewhat take that need portion out of it. State assistance, where it's families first. Food assistance like SNAP. So I will share, we were looking at some different income levels at a hospital, for example, that they were collecting on individuals. And it was interesting because the applicant indicated that they received $184 worth of food stamps, all right? So obviously that person was considering it income. Well, it is income to them, but it's not one we're going to count. So we're going to exclude that. So food assistance, we're not going to count that. Same thing with housing, same thing with energy and utility assistance. Social Security is another one of those tricky things, right? And that's because Social Security is not a means tested program. In other words, it's not based on need like SSI. SSI means I'm disabled and I'm really low income, I'm really poor, I need assistance, help with that way. It's not based on need, but rather it's based on somebody's work history, right? So typically it's going to be, the applicant's retirement benefits that they're actually receiving. It could be Social Security disability insurance, SSDI. And tomorrow, if you're going to be here, we're going to talk about ways to determine whether or not the person's receiving SSI or SSDI. And a little teaser there is we're going to actually look on when that person receives the check. Then we're also going to talk about, widow benefits could be one, survivor benefits, kid, we have a parent that passes away, and now the child is receiving Social Security payment based on that parent's work history. So, if it's a tax filer, not claims as a dependent, key. And we're going to include all that Social Security. Right? We don't need to worry about what portion is taxable and what portion isn't. Right? Because we're going to include it all. Because remember, we get the MAGI, we add back in that non-taxable amount of Social Security. So we don't really need to go through that nice convoluted exercise of figuring out what, if any, of this Social Security benefit is going to be taxable. And once again, it's not SSI, that's completely different. Tax dependence, on the other hand, is a different story. Okay? So we're only going to count it towards the household income if the dependent is required to file taxes. Remember that? So the dependent has to be required to file taxes, and then we'll figure out if it's going to count. Any of their income is going to count. So that means, remember going back to that $6,300 and that $1,050 I was talking about? Well, Social Security would be in that $1,050 range, right? But we need to know what portion of that Social Security is taxable, because only that taxable portion is going to count to that $1,000 threshold. Everybody following me, right? That's the reason why we kind of need to know. Now, once again, IRS Publication 915 will help with that. The other thing I like about Publication 17, your federal income tax, if there's another publication the IRS has that goes into much more detail, it'll be linked in there. So you can click on that link and it'll take you right to that publication. There's a really fast way to check it. And that's if you take the total Social Security benefit for the year, divide it by 2, add in all the other income, and if it's less than $25,000 for a single individual, or less than $32,000 if the person's married, then none of the benefit is taxable. If none of the benefit is taxable, it's not going to go towards those $6,300 and $1,050 threshold. Not going to count. All right? That's big. If it's over that amount, that doesn't mean that it's taxable, or the amount that's over this is taxable. You've got to go through this convoluted 19-step formula for doing that. Once again, there's handy little worksheets in there to help you figure that out. For the most part, if Social Security is the only source of income that the individual has, 9 times out of 10, or 9.9 times out of 10, none of it's going to be taxable. Now, so if we're going to recap this, tax filing, not claims as a dependent. We're going to add all that back in, so we don't really care what portion is taxable and what's not. We're going to count all of it. If they are tax dependent, okay, once again, so red flag, tax dependent, getting Social Security, we need to check into that, see if this is going to make them be required to file taxes. We're only going to count the taxable amount towards those dependent thresholds to see if they're required. If not, we're going to exclude all of it, okay? So let's practice with this one. Raina gets $1,200 a month. Daphne gets $1,200 a month. Maddie gets $1,200 a month. They're all survivor benefits. Let's say Raina was married, her husband passes away. They're all collecting this amount of money. What is, let's assume it's a household of 3. Applied all of Chris's rules and checked with them and said, yep, they're a household of 3. What is the family's monthly Magi income? And I think we probably have treats, candy for people to get this right. Who wants to go out on that limb and tell me what they think the Magi income is? What do you think it is?
I think it's 0.
You think it's 0?
This is survivor.
But it's Social Security, right? Let's assume Raina's filing taxes. Are we going to really care what portion of her Social Security is taxable as a tax filer? No, we're not. So we know Raina's going to count. What about Daphne and Maddie? Who thinks it's going to count? Show of hands. Who thinks it's going to count? Okay, there's a couple of people. How many think it's not going to count? Okay. Why isn't it going to count? What's that? Why is it, why, if you're saying this is not going to count, why isn't it going to count? Why are you excluding it? Okay, so what we have to do here, right, is we have to look at each one of them. 1,200 a month is quite a bit. So we'd multiply that by 12, right? And then we would divide that by 2 and subtract it from 25,000. You know, I'm a lawyer, not a math person, but I think that's less than that. So they're not going to be required to Now their Social Security is going to count. We have no other income. They're zero. Are they required to file taxes? Nope. So guess what? We're not going to count their income. So here's how we figure it out. Right? So tax filer, we don't really care even though it's not taxable. But we're going to add back in that non-taxable so we get $1,200 a month. If we look at dependent, $14,400 a year divided by 2, plus other income, which is 0, 72 is less than $25,000. It's not taxable either, but because it's not taxable and it's less than the threshold, then there is 0, so none of their income is going to count. So that's Social Security. Let's talk about a few other weird things that kind of pop up. Life insurance proceeds, lump sum proceeds paid to beneficiary and not considered income. Gifts and inheritances of money or property is not considered income to the recipient. All right, these are MAGI categories. And generally, there's a $14,000 gift limit for 2016, but that only triggers a tax filing. Someone can actually be given more than that, right? And if they are, that doesn't make that income taxable. It just means that whoever gave them that money will probably have to file a gift tax return. And even then, that doesn't mean any of it will be taxable. It just means they have to file that return. The main takeaway here is if you got somebody that's giving money to somebody to help maybe pay a medical expense or something like that, or just giving them money to live, for MAGI, chances are we're not going to count that income because it was considered a gift. Unemployment, another question comes up all the time. All payments are considered taxable. So think about it this way. Unemployment is designed to replace wages from working. Wages is considered taxable income, so why would we not include unemployment as income? All right? So that's the easy way to remember. That is replacing income. Chances are replacing wages, so it's going to be considered taxable. Workman's compensation is not considered taxable. Why? Well, most of the time that's compensating someone to make them whole again if they've been injured. So to the extent that it's a compensation for that and not lost wages, it's not going to be considered taxable. Child support. Okay? So for child support, unlike alimony, the payor, whoever's paying the child support, they don't get to deduct it off their taxes. And whoever receives it, it's not counted as income. All right? Alimony is a different story. Payor gets to deduct. Remember, that's one of those above-the-line deductions. They get to deduct that amount that they pay. But the recipient has to count that as income that comes in. Another important thing that we need to do is we need to consider, is this going to be monthly income or is it going to be projected annual income? So if we're dealing with tax credits, we're going to project annual income, right? That's how much we think that they're going to make in that year. If it's Medicaid, it's a point-in-time determination, so we're looking at monthly income. So here you see here, so TennCare covered kids is we're going to look at month of application. Tax credits, we're going to project for the year. And we have to project because as a society, we pay our taxes after the year is over, right? And if we're going to get tax credits, everything's going to be tied into a tax return. That's why we got to project how much it's going to be worth. Let's do a little more practicing. So Raina and Teddy both receive SSI, Supplemental Security Income. Right? They have 2 children, Maddie and Daphne. What is their household income? All right, very good. I heard 0. And why is it 0? Right, because it's a government benefit based on need, right? So we're not going to count those. So if that's all they're receiving, we're not going to count it. Their household income is 0. Raina's a single mom. She's a musician, earns $1,500 a month. We have 2 daughters, Maddie and Daphne, 16 and 14. They get $500 a month in survivor benefits from a deceased father. So Social Security survivor benefits. what is the household income? Let's assume we checked with Chris. Once again, this is a household of 3. $1,500. I heard that several times. Very, very good. So we can pass out candy. I think these gals here got this one right here in the second row. All right. And why is that? Well, we don't have other income, but we're really looking at that Social Security benefit, right? So for the year, it's going to roughly be $6,000 divided by 2, add in all our income. Is it less than $25,000? Yes. What's the likelihood that this Social Security benefit is going to be taxed? None. So we're not going to count that $500. But it's $1,500 for that example. So let's just talk about some just general practice tips. Remember, dependents, whether we're counting household composition, who's in the household, or if we're counting income, we got to know that there are some special rules that we want to apply, right? So you got to do the 3, the 3 exceptions to the tax filing unit when it comes to counting households. Someone other than spouse or child of the tax filer. So that picks up grandma. And we've also got to consider if it's someone that is maybe with a household that has 2 parents that don't file taxes together, they file separately, exception number 2. And then 3, they're claimed by non-custodial parent, right? Remember all that. So that's a household counting exceptions for dependents. For income, we've got to make sure they're required to file taxes. Right. Now for Magi, Chris mentioned it briefly. Sometimes for some TennCare categories, we've got to consider resources or assets. Now for Magi, we don't. That's the nice thing about it. There's no resource requirement. Okay? And then look for estimated yearly versus month of application. And be careful of this trap. Right? If someone's unemployed, they just get a job. If you take their monthly income and multiply it by 12, they might be eligible, let's say, for premium tax credits because they're above 100% of FPL. But if you really look at what the projected income is, and if they didn't work the first half of the year, they might be below that level. So watch out for people that maybe were unemployed or maybe recently graduated that has a high monthly income now, but when it comes to projecting their income tax for the entire year, it's not above 100% of FPL. You want to watch for those instances. So non-Magi income, it's pretty much like counting income for Magi. There are some key differences. Child support is treated differently. Gifts and inheritances are treated differently. Veterans benefits can be treated differently. Same with minors' income and step-parents' income. All right? Child support, this is a big one. There is it counts as income, but there's a $50 per family disregard. Not per child, but per family, okay? For Magi, remember, it's not considered income. I'm going to count any of it. And situations where this is going to come into play is really going to be medically needy spend down. That's one of the places where you're really going to see this. So pregnant women and kids, medically needy spend down. Okay, that's something I got to consider a little differently. Gifts and inheritances can be considered income in the month that they receive it, and if it's money, it can then become a resource later. All right. And same thing with life insurance proceeds, but keep in mind you are going to be able to disregard the portion used for burial or the payment of a last medical expense. Once again, for Magi, we're not going to consider those. With non-Magi, primarily medically needed spend down, that's something we need to consider. So one of the things that comes up frequently, I'll just kind of toss in as additional bonus practice tip. If you run across families that maybe they do some of this crowdfunding, this family has some high medical expenses and we want to set this up so people can make a donation. Be careful that that money doesn't go straight to the recipient, but rather maybe to a family member that isn't in the household that can pay those expenses directly, so you don't have to worry about whether it's going to be considered income to the individual as a gift, all right? So that pops up now and then, especially with social media and its popularity today. Just think of ways, look, don't have that person in that household getting that money. Have it maybe go to a trusted friend, a family member, maybe to a bank or financial institution that can then pay that medical expense directly, and you just sidestep all those income issues. VA program, there's a lot of things for veterans administration. If there's a question about that, I would suggest that you just reach out to us and we'll walk through it. We'll see if we can figure out what portion of that would be taxable, or excuse me, would be subject to counting as income. But basically, if it's based on need, we're going to exclude it. Minor income, all right? So non-magi, you get to disregard a minor's income. Notice at the age is 21 and younger, if they're a full-time student. Okay, so now the trick is, are they a full-time student? And if they are, we're not going to count it. If they're not a full-time student, then we get to disregard 6 months worth of income. And there's no deeming of income from one child to another. Remember, Chris mentioned something about deeming. We're not going to take income from child to child. We will take it from a parent to a child. And remember, for Magi, we don't really care if they're a full-time student. We really are concerned about whether or not they're required to file taxes. Step-parents. Because most of the non-Magi, if we're talking about medically needed spend down, is based on financially responsible relatives. In most cases, a step-parent is not financially responsible. There are a few limited exceptions. But usually they're not financially responsible, so we don't exclude the parent's income, okay? The step-parent's income from that. With Magi categories, we're not really worried about their step-parent or not. We're worried about whether or not they're in the tax filing unit or whether or not they're an exception to the tax filing unit. We really don't care if it's a step-parent or not. So, child support, remember, is $50 family disregard, not per child, but per family. Gifts and inheritances can be considered income, and it can become a resource. All right? We'll talk a little bit more about resources later, ways that you can maybe work around that to get around the resource limits, especially with spend down. Veterans benefits can depend on the category. Minor's income, remember, we're looking for full-time student. We're not going to deem income from one child to another. And step-parents, generally, income does not count. So let's talk about separate or no income counting rules. There are a couple of these. SSI. So if somebody is actually receiving SSI, okay, they should already be enrolled in TennCare. But there are going to be separate income counting rules, and Chris alluded to them. They're very complicated. For the disability-related categories, PICL, DAC, Dow, those are the ones that are going to have those. We're going to talk a little bit about that. There are what we call a general income disregard. There's an unearned or an earned income disregard. There's also a disregard of half that income. It can be pretty complicated. If you run into one of these, you're concerned about whether or not you're counting the income correctly or need help counting it, reach out to us because it is complicated. Breast and cervical cancer treatment program. That is typically a program that the federal government has. So in most cases, it's really not a specific income counting for TennCare. It's just whether or not you're able to get into the program itself. So you go to the health department, they're going to screen the income of whether you're eligible for that program. But by and large, TennCare is not going to be checking breast and cervical cancer. Newborns and moms on TennCare, the time of birth, we're going to deem the child is going to be deemed eligible for TennCare starting on the date of birth. Okay, so we're not going to check income at that point in time. Former foster youth. Now this is an area where it can be often overlooked, all right, because I don't know that a lot of outreach is going on for former foster kids. So with the passage of the ACA, we know that one of the benefits was children could stay on their parents' health insurance till they turned 26, right? Kind of the same thing here, right? So if they're on foster care when they aged out at age 18, enrolled in TennCare at the time, right? Then they don't have to go through an income check. They can automatically be rolled into TennCare and keep it until they turn 26. So watch for any applicant you're working with that might have been a foster child when they were in foster care when they aged out. They aged out in Tennessee and they were on TennCare and they're under 26. You might be able to get them rolled quite easily. So that runs us to coffee break time, unless people have just burning questions on income that they want to know. Okay.
All right, how are you guys doing? Are we okay? We're going to take a break so you guys can use the bathroom and get coffee. One thing you can also do during this break is if you have questions, you can write them on the Post-it notes and put them on the boards around the room. So if you want to have some questions answered, please do that. Two very fast announcements. If you tweet based on our hashtag on one of these tables, the person who tweets the most is going to get a free t-shirt at the end of the training. So if you tweet, take a picture at the photo booth outside during this break, if you have some extra time, there's a screen and feather boas, there should be a John Wayne cutout somewhere, some sunglasses. If you take pictures and then tweet using our hashtag, whoever tweets the most will get a free t-shirt. And so please do that. And speaking of free things, we promised to have a raffle. So we're going to draw 3 names right now for someone to get some free things. So first, we're giving away some very snazzy TJC sunglasses. They're purple and they have our logo. So if I draw your name, come up to me during the break and I'll give you your TJC sunglasses. Maria Ramirez, congratulations, you got some sunglasses. All right, next we're going to give away a TJC mug, So let's see who's going to get the mug. Maureen Newman, you're going to get a mug. Come see me during the break. And then finally, we're going to give away a free t-shirt, a free TJC t-shirt. So Janet Carroll, you get a free TJC t-shirt. If you go back into the back and see Devon, she will make sure you get the right size. She's waving her hand up there. All right, y'all, get some coffee, use the bathroom, take a stretch, and we'll meet back here in 15 minutes. Huh?
Yep. Stand away from the mic. Right?
On the table.
All right, folks, I think we're going to get started again. It looks like we've got most of you. So first, let me introduce myself. I'm Andy Hofer. I am a client advocate and the intake coordinator at the Tennessee Justice Center. So what that means is that I handle my own individual cases, and I also see every single case that comes in through our office. If you ever see one of our other advocates looking stressed out, it's probably because of what I gave them. So we are going to talk about children for the most part, but first let's start with a quick eligibility overview. There are three things that we're going to look at every time we are determining somebody's eligibility, and then one thing that we're hopefully going to do. So one, they need to be in an eligible category, something that I'm going to talk a little bit about, and then Rob's going to talk about even more after me. Two, we need to look at their household income. We need to make sure that that qualifies. I know that we heard a lot about that today. Three, we need to look at their resources and assets for some categories. I'm going to talk about one that does not have resource caps. And then four, if all three of those things are in order, we go ahead and we apply and we get some people health insurance. So let's talk about one group that does, and I'm going to go into this first one here, the children, and they almost always qualify for something. But for categories, these are basic questions that we can ask to know somebody's probability of being eligible. You know, we still have to go through the income and resources, but are they a child, a pregnant woman, a parent or caretaker relative, or a person with disabilities? And these, at least the first three, are the MAGI categories. I think you already talked about MAGI. I just want to point out that it's a bit of magic. And I think we'll move on from there. You guys have heard enough. All right, the MAGI categories: children, pregnant women, and parents and caretaker relatives. I get the fun one. I get the kids. Almost every child is eligible for something. So here I get to issue you all a bet. I just gave everybody on the webinar a headache. So anyway, I get to issue you all a bet. Our executive director, Michelle Johnson, you heard from her at the beginning of the day. She says that if one of you can find a documented child in Tennessee that isn't eligible for something, from TennCare all the way up to premium tax credits, we will send you some, and then you give that case to us. And we can't find a way that that child is eligible for something. We're going to send you some big, ugly purple prize. We haven't decided what it is yet, but just wait, find that ineligible kid, and you'll find out just as soon as we do. So almost everyone is eligible. The caveat is, of course, undocumented children. The coverage categories that children might fit into. We've got TennCare Medicaid, and then we've got covered kids or CHIP. I like to think of these as tiers that tie into the income part of eligibility. So the very bottom, we've got TennCare, and Medicaid, or TennCare Medicaid. And then if they're not eligible for that, the next thing we're going to check for is cover kids, which has higher income limits. And then, of course, after that, they get into premium tax credit realm, and that's one Tennessee Justice Center is done with them, and we need the help from all of you marketplace experts who apply for people all the time. So, TennCare Medicaid, children up to age 19 can get it. That's the key to remember. And let me pull out my notes here. I'm not used to this computer. Anybody ever used a strange computer and then you get up there and you don't know quite what's going on? I don't have any notes on this slide. It is what it is. So just remember that they're based off of the federal poverty level, and they adjust in the spring of each year. So when FPL changes, so do these numbers. So again, you're going to look at, we've got their category, they're a child, and then we've got their household size, which ties into their income and their well, for TennCare Medicaid, no resource limits, so we're tying into the income. And it varies based on household size, which is why all of that really exciting stuff you heard from Chris is actually really important.
And then cover kids, the next tier up. So say they didn't fall into one of these here. They don't quite fit the income limit. Well, we're going to check them for cover kids. Again, it's based off of the federal poverty level. Pretty simple, just 255% of the FPL, just with size of the family. A few things to note about cover kids, and they're right up here on the slide for you. You cannot be enrolled in another health plan when you're on cover kids. So most likely these are people who are slightly higher on the income bracket. You're going to see a lot of people who might have employer-sponsored insurance. If they're utilizing that insurance, if they're enrolled in it, they cannot also be enrolled in cover kids. And you're going to apply on the marketplace, just like all TennCare categories. Except for long-term service and supports. We're going to let somebody else talk about that later. Anyway, you accomplished all of that, and you've got a covered kid. Newborns, because who doesn't love a baby? We've got 3 things to talk about. Logan just gave me a really bad look. I don't think he likes babies. We've got TennCare deeming, cover kids deeming, and newborn presumptive eligibility. Let's talk about each in a little bit more detail. So TennCare deeming. For moms on TennCare, the child is deemed eligible for TennCare for 1 year. The cover starts on the date of the birth. And pay attention to this because when we talk about cover kids, it's going to be a little bit different. And they call the Tennessee Health Connection. So you don't have to go through the marketplace for a newborn. Mom's on it, child is deemed on it as well. Cover kids deeming. A little bit different, just like I said. It's in the toolkit on page 21 if you want to look into it. And it works essentially the same way. If mom is on cover kids, baby can also get on cover kids. Now, the caveat with cover kids deeming is that the cover starts from the date the mother enrolled in cover kids and it lasts for a year. So say that mom enrolls in cover kids to cover some prenatal expenses. Good, we all want her to do that. She enrolls at 6 months. Her coverage and baby's coverage is going to stop a year after that 6-month mark. So in other words, when baby's 3 months old. Is that math right? Somebody double check my math. Again, lawyer, not mathematician. I think I got it right. No, that'll be only 6 months. 9 months old. When baby's 9 months old, coverage stops because it's only lasting the year after the application, after the mother gets on it. Now, sometimes you're going to have to make the decision between TennCare and cover kids. What if a mom is on cover kids, but the newborn is eligible for TennCare? I think there should be candy for this one. Who can tell me who this might apply to? Where it's going to come up quite often. Undocumented mothers can get on cover kids, but they are not eligible for TennCare. Once baby is born, baby's now a citizen, right? And may be eligible for TennCare. So in order to do this, you call cover kids. What we've been told is that if the child is eligible for TennCare, but the mother is on cover kids, and so it's a deeming situation, that cover kids will facilitate or help them enroll in TennCare, make sure that that happens. That's what we've been told is happening. We haven't seen it yet. If they're not, I mean, that's going to be your first route is do what TennCare says is happening. But if that's not the way it's playing out, please do let us know because something needs to be fixed if that's the case. Even if it just happens once or twice, we need to know about it. But at any rate, call cover kids. They will either enroll a kid in cover kids if that's what they're eligible for, or hopefully facilitate enrollment in TennCare. Now, newborn presumptive eligibility. What is this? It is for babies. That means 12 months and younger. We've got some terms to define here. Born to mothers on private insurance or no insurance. So the deeming is for mothers that are already on TennCare or cover kids. Presumptive eligibility for mothers on private insurance or no insurance. And the effective date of coverage is the date of application, just like TennCare. How do you apply for it? Simply call Tennessee Health Connection. I know, how many of you work in hospitals that have pediatric? A few of you? And I know that sometimes the hospitals help facilitate this, but otherwise the parents can do it themselves too. And they just call, they report the birth, and the child is enrolled in TennCare. The catch is that they are only enrolled for the month of application through the end of the following month. If it's any time past that, they need to, well, during that time period, during that month, month and a half, whatever you have, depending on when you applied, you must do an application on the marketplace. Now, once that application is submitted, the child is going to remain covered until the final eligibility determination. But without that application ever being submitted, the presumptive eligibility expires, coverage goes away. So that's children. And with that, I'm going to turn it over to my supervisor, who is hopefully going to let me keep the job after the presentation, Rob Watkins.
I think we'll keep Andy around for a little bit.
Just for the time being, right?
For the time being, at least till tomorrow. All right, so we're going to talk about pregnant women. A lot of it kind of overlaps with kids. There's TennCare Medicaid, there's presumptive eligibility, and then there's Cover Kids. So for pregnant women, they can get TennCare if it's below 200% of the federal poverty level. And if you'll notice here, household size always starts at 2. We don't have a household of 1 with a pregnant woman. And remember, what's the household counting rule about pregnant women? That's right, we're going to count the number of unborn children, right? So if mom is only pregnant with 1 child, this can be a household of 2. If mom is pregnant with twins, it's a household of, everybody wants? 3, that's right. So the other thing, and Chris mentioned it, also to kind of keep in mind is when you're looking at other people in the household, right, then we're not going to count those unborn children. So if we had a household of, let's say, 4 people, let's say mom, dad, and 2 kids, mom's pregnant with twins, mom's household would be 6. When we start looking at dad's eligibility or the kids, it's going to be that back down to the household 4. We're not going to count those unborn children. No, we're going to count those unborn children for tax credit purposes because you can't claim as a dependent a child that's not born yet. So presumptive eligibility means you can get TennCare immediately. And to get it, the mother needs to go to the local health department, right, and ask to get enrolled into presumptive eligibility. So the rationale is we want to make sure that the child is being taken care of during the time period leading up to birth. So we want to get all that prenatal care. We want to make sure that we have a healthy baby that's born. That's kind of the rationale behind presumptive eligibility. The trick is you still have to apply for TennCare, and that's the main takeaway. So even if mom, the pregnant woman, goes and gets presumptive eligibility at the health department, it's imperative that she still finishes that TennCare application, and it's by the end of the month, following the month when presumptive eligibility begins. So if, for example, mom went and got presumptive eligibility on October 15th, okay, then she's going to have until the end of November to get that application in on the marketplace, okay. Now, coverage should continue, right, assuming you do this, coverage should continue until TennCare makes a determination on eligibility. So, if it falls into the abyss, it becomes basically a Wilson client, and no determination is made for a long time, mom still stays on. Okay? If you run into situations where, for whatever reason, they cut her off, but they still haven't made a determination on that application that was submitted, please let us know. We cover kids. Pregnant women can also get access to health insurance through Cover Kids. We cannot have maternity coverage. Once again, Cover Kids is big for the undocumented immigrant population. So the idea is go and get enrolled in Cover Kids. That way we can get the prenatal care for the child. Chances are we'll be born in this country and we'll be a citizen, right? And then that's, once again, as Andy kind of mentioned and touched on it, it's going to be important then to kind of look, is this maybe TennCare eligible, which has more benefits than Cover Kids, or is this still Cover Kids deemed issue? So they can get Cover Kids and also covers 60 days postpartum. You still have to apply on the marketplace, and get the presumptive at the local health department, and it's important that you fax the application to Cover Kids, and there's a number that takes care of pregnant women. Let's talk about parent and caretaker relatives, right? So we've had a lot of different age levels for when is a kid. But for parents and caretaker relatives, it's TennCare for the parents or the relative that's taking care of the minor child that is under 18. Or they can be 18 if they're a full-time student. So the important thing is they have to be living with the persons that you're trying to get the caretaker relative coverage for. And they have to be a relative, right? That's a fifth-degree relative. That's pretty much about any type of blood relative you're going to have is probably going to qualify or something to try. I believe it's also in the manual. If, for example, you have a relative that is actually claiming, remember this is a MAGI category, is actually claiming one of the minor children as a tax dependent, they're going to presume that they're making those day-to-day decisions for them if they're claiming them as a dependent. I'm just going to follow them back to you. Now, this is coverage for the parent, not for the kid. Right? So the idea here is we want to make sure that the person who's responsible for raising the child is actually going to have access to health coverage that can be helpful. So as I mentioned, this can be a lot of different relatives, right? So uncles, aunts, grandmother, grandparents, okay? Those are types of people that would qualify, once again, if they're claiming them as a dependent and their relative, and chances are they're going to meet that threshold. Providing the primary care for the child, I like to think of day-to-day decisions. You know, they're making decisions about schooling and where they stay and how they eat, things like that. Those are all going to be things that are going to help establish that primary care for the child. Okay? And it's important, these people have to apply on the marketplace, and it is a MAGI category. Interestingly enough, it's not really based on federal poverty levels, but rather kind of set by rule. And these are the amounts that are there. However, we mentioned that this was a MAGI category, and where do we have to apply? We have to apply on the marketplace. Do you think the marketplace can apply these statutory or rule-based numbers? No, they cannot. So instead what has happened is they have taken a percentage of the FPL, which I think is running somewhere in the neighborhood of about 104, 105%, and that's what they're using. So if you apply on healthcare.gov and it comes back saying this person might be eligible, the parent caretaker relative, chances are it's applying that percentage of the FPL. I'm not doing this. Not quite sure how TennCare is applying it, if they're just accepting what healthcare.gov is telling them, or whether or not they're also applying these numbers here. Talk a little bit about the safety nets, other ways that there could be some coverage. So TennCare standard, right? It's really geared for children under 19 who are on TennCare, right? But becoming eligible due to an increase in earned household income, right? So TennCare standard is only for kids, okay? So not for adults, just for kids. You cannot have access to employee health insurance. So kid cannot, parents cannot have access to employee health insurance. It's going to be one of the requirements. Then there are basically two ways, which effectively is one. Below 217% of the federal poverty level, if that earned income kind of if it ends up going up, now you get to be below the 217, okay? Or if you have a qualifying health condition. We cannot find the qualifying health conditions. Now, this is really kind of a carryover from pre-ACA. So we know that the Affordable Care Act got rid of the pre-existing condition requirement, right? Well, this was set up initially to kind of catch that. So this child would not be insurable. Well, we don't really have those problems anymore with pre-existing conditions, and we don't see too much on qualifying health conditions, strictly below 217% of FPL. Transitional TennCare, low-income families who lose their TennCare due to an increase in earned income. They must have been covered by TennCare for 3 of the last 6 months. All right, so this is people that start having maybe changes in the hours, which is changing that earned income. But the income prior to losing eligibility was below the current caretaker relative income standard. All right, so most of this transitional TennCare standard, you're probably going to maybe see more of this now that redeterminations have started. Tomorrow, Gordon's going to talk in quite a bit of detail about TennCare redeterminations, but that's when this is probably going to tend to come as a potential area for someone being covered. And for some people, they haven't had a redetermination in 3 years. You might not have seen much of this in real life yet. But just the main takeaway is, all right, somebody, because their income has kind of gone up, they've been on TennCare in the past, they're going to lose it. I remember Rob talked about it at the training. Let me kind of look it up and then give us a call. Because one of the things we want to be able to do is kind of monitor how is TennCare standard working, especially with redeterminations, how is transitional working. Extended TennCare, this is low-income families who lose TennCare due to increased spousal support. All right, so think of alimony primarily. Covered by TennCare 3 of the last 6 months. The income is going to be, excuse me, compared to the caretaker relative levels. All right, and then they get to actually keep that for up to 12 months. So once again, main takeaways, get changes in earned income. Got a raise, working a different job, working more hours, that's going to change that income. And now that they're kind of, sometimes they're on, sometimes they would be off. And that brings us to Kyla.
All right, so we're going to do a little bit of practice now. You may recognize a couple of these questions from your pre-test, and they will also be, again, on your post-test. So it could be in your interest to pay attention if you want to, but if not, like we said, no judgment on the pre and post-test. It's just so we know how much you guys are learning. So let's practice. Kimberly and her husband Kanye live with their daughter North. In case you've never watched the show Nashville, we threw this in here in case you wanted some faces you could recognize. Kim and Kanye filed taxes jointly, and they claim North, their 3-year-old daughter, as a dependent. Kim is now pregnant with another daughter. Their household income has gone way down. It's now $3,500 a month. So important to clarify, that is going to be their monthly income. That's going to be their monthly income. So for those of you who haven't been doing this for a long time, I want to point you to sort of how to use our resources. If you go to the toolkit, this toolkit, go to page 7. So page 7 is where you can use this TJC coverage cheat sheet to figure out someone whether with their monthly household income if they're going to be eligible. So the household is at the top, you guys understand. So let's look at Kanye. What is Kanye eligible with his $3,500 a month? If someone wants to raise their hand and answer with the microphone, we'll give you candy if you answer correctly. So if that's any incentive. Kanye. What would Kanye, the yeah, I mean, yeah, that's an answer. All right, Candy. What else? What else? Yes. Is that you back there? Raise your hand if you just answered. All right, we'll bring you some candy. Premium tax credits. Premium tax credits. So that is what Kanye would be eligible for, premium tax credits. Let's look at Kimberly. Kimberly, what would she be eligible for? She is pregnant. She is pregnant. Yeah, TennCare. Why is that? So that's such a good answer. All right. So she said she's eligible for TennCare. Why? If you look at it seems like she has a household of 3, right? No, she's pregnant, so her household is 4. A lot of you guys knew that, but we just want to reiterate, if your household, if you're pregnant, the unborn child counts in your household. So with a household of 4, she is going to be eligible for TennCare. Yeah.
I thought if she was pregnant, she could count the family.
Right. So the unborn child counts in the household of the pregnant woman. Mm-hmm.
But not in the household.
Exactly. So the unborn child counts in her household, but it would not count in the household of Kanye or of North. Exactly. So for Kanye, his household size would be 3, and for North, her household size would be 3. The only exception to that would be if North, who is a child, would be applying for medically needy spend down. For that, there's an exception, and the unborn child would count in her household if she's applying for medically needy spend down. That would be the only exception to that. All right, so then what is North eligible for? Cover kids, cover kids. Raise your hand if you got it right, and we'll find a way to give you candy. All right, so to reiterate some of these points, for MAGI categories, Tennessee counts the woman plus the number of children she expects to have for her household only. It seems like you guys have gotten that. All right, we're going to move on to practice scenario 2. For practice scenario 2, Chris's daughter Chloe goes to jail. Chris is granted custody of Chloe's 18-year-old daughter, Carmen, who is a full-time high school student. Chris earns $1,000 a month. Chloe's daughter, Carmen, earns $400 a month from a part-time job at an ice cream shop. So let's assume that Chris is expecting to file taxes and claim Carmen as a dependent. So what is Carmen eligible for? If you look at our coverage cheat sheets, what would she be eligible for? TennCare. Exactly, TennCare. So that's pretty easy. But she's 18 years old. Is that too old for the coverage category for children? No. Under age 19. Good. What about Chris? What is Chris eligible for? TennCare. TennCare. But again, it's because, why is she eligible for TennCare? Carmen is 18 years old. Usually, a parent or caretaker relative is only for if the child is under age 18. What is the exception? Exactly. She's a full-time student. She's a full-time student. All right, you guys are on it. So, yep, the exception is if she's a full-time student. So look at that. If you have an 18-year-old, usually that wouldn't make the person who's taking care of them eligible, but look if they're a full-time student. All right. our last practice scenario before we go into a Q&A portion. We're back to the show Nashville. We're back to the show Nashville. No more Kardashians. Juliet has given birth to her daughter Cadence in Nashville on June 22nd. Secretly, she's an undocumented immigrant from Canada. If you watch the show, you'll never know that, but we'll tell you here first. Juliet was on Cover Kids at the time of birth, and her husband Avery is also an undocumented immigrant. They live together, they have no other children, and their household income is $3,000 a month. Using our coverage cheat sheet, what would the daughter be eligible for? TennCare, yeah. So she could be deemed eligible for Cover Kids, and that is because the mother's on Cover Kids, but her household income makes her eligible for TennCare because she's a citizen. So what do? How do you get her on TennCare? So what we've heard is happening is, exactly, if you call Cover Kids should be facilitating enrollment in TennCare. So that is actually what should be happening right now, that what we've heard is happening. If it's not happening like that, please let us know. Yeah. We have a question back here. Do you want to bring a microphone to her, someone? Did you have a question back there? Okay. What?
What you say should be happening right now?
What should be happening is that Cover Kids should be facilitating enrollment in TennCare. So if you call Cover Kids to report the birth, the child is eligible for TennCare, they should be facilitating enrollment for that child into TennCare. So because the mom was on Cover Kids at the time of birth, but the child, who's now a citizen, is now eligible for TennCare according to their household income. The mom wasn't eligible for TennCare because she was an undocumented immigrant. So because the child's now eligible for TennCare, the way to get the child on TennCare is to call Cover Kids, and they should be facilitating that enrollment. Does that make sense? All right. Yeah.
So what is the household income for the child?
The house.
Yeah. I'm not sure how to count the income.
You want to take that away?
Oh. So the question is, what is the household income for this child with two undocumented parents? Is that right?
Yes.
Okay. The answer is $3,000 a month. Is that right, Rob? We're going to let the guru look at it real quick to make sure I'm giving the right answer.
And so it's a household of 3?
Yes.
I just wasn't sure about the undocumented part.
Yep. No, we're still going to, as far as we know, we're still going to count their income. There's nothing in the regulations that would say differently. So.
They're not going to be filing taxes or anything. They're not, right?
Well, not necessarily. I mean, they could be.
It could be tax filing. So you're still going to have to count.
All right, we're going to get the guru up. He's getting into details here.
So we're still going to count. We're still going to count income, right? Even if they're undocumented. So they might be a situation where they still might file. They might have a temporary tax ID number. They might file, or they might be considered a non-tax or not claimed as a dependent. So either way, we're still going to count their income. And when you deal with undocumented or people that are immigrants that are subject to a 5-year bar, for example, there is something called emergency Medicaid that is available. I don't know if we're going to talk about emergency Medicaid in much detail or not. However, we do have a toolkit is available. The long and short of it is emergency Medicaid is available to undocumented immigrants, and it's also available to people subject to the 5-year bar, provided they are otherwise categorically eligible, right? So we're still going to count households. We're still going to count income, all right, even if they're undocumented, right? And then that's going to determine. So on a household of 3, for example, they're undocumented. Let's say it's a caretaker relative situation, and they go apply for emergency Medicaid. They would take a look at that and say, but for your immigration status, would you be otherwise categorically eligible for TennCare. If you are, then they would be eligible for emergency Medicaid, which is limited. It's just to care for an emergency situation and stabilize it. It will cover for part of it. It's primarily going to be hospitals that deal with it.
Previously, we've been working with you for the document evaluation. They're using PE.
Yes.
And then the coverage application is not in process, so I know that we have to file an appeal, and so what else are you doing to resolve the issue? I'm just confused because we're getting more of those, and we're not allowed to file an appeal on the health department, but of course, if it's a language barrier, and we don't know what to do, we kind of assist in filing an appeal on those behalf with them in the office. So I wanted to know what you guys feel about that.
Yeah, so the appeal is the right thing to do. Oh, yeah, so the question is, let me see if I've got this right, is that you're applying for, that they're giving undocumented women presumptive eligibility, is that right?
Right, so what happens with the coverage application is just stay in the system, just stay there on standby.
Yes, so if you haven't heard back after 45 days, you're doing the right thing, you're filing a delay appeal, right? And then it's still not going anywhere?
Well, that's what I'm wondering, because we reached out to you guys to find out how to handle it.
Uh-huh.
Since sometimes the effective date will end, probably within 3 days or so, and they still don't have coverage in place.
Okay, yeah, so the presumptive eligibility, we know that lasts for the month of application through the end of the next month. If the application has gone in, the presumptive eligibility continues. So they're still covered even though there hasn't been a determination yet. If you're not finding that to be the case, then call us and we won't say exactly who, but we will open up a direct line of communication with TennCare. And
whenever you run into that situation, you need to refer those to us, okay? And then we can work. A lot of times, an appeal is a way to get a live person to take a look at the case, especially if it's eligibility, and get it resolved. Where if it's done, virtually or through healthcare.gov or a variety of other means, a lot of times it'll fall into a black hole, for lack of a better term, where no determination is actually being made. So an appeal actually helps somebody get, in those situations, I think Chris has actually been working with some people that's kind of popped up. So if you'll just refer those to us, then we can see what we can do. Whether it needs to be an appeal filed, or if it's just simply a call that can be made to TennCare to work on that, we can see about getting that resolved or cover kids.
So if they appeal, if they don't know about the appeal, and they'll come to us with 2 days before the car expires and tell you that the hospital said that they will lose it on the 30th.
Well, I think,
on the 28th.
so I think the best thing to do is the minute you have one of these situations is encourage them to reach out to us. I mean, you're going to kind of see the pattern of, okay, this presumptive, and now there's a problem with covered kids. Also, just come to us and see if we can facilitate fixing those matters.
no, if I can add to that, you said that they have not filed the appeal and they only have 2 days. That's when you got it, right? Okay, yes, have them reach out to us, but also have them file that appeal. Because we do not want them to run past that deadline. We handle well over 700 cases a year, so sometimes it will take us a couple days to get to something. So advise them to file that appeal. That's what we would do as soon as they called in. Let's see, who's got a microphone? In the back there.
So, answer to the bottom question, what had worked for us was just doing paper application and passing it straight to cover kids instead of doing kind of online application for people with Social Security number. You said needed to take to cover kids, asking to cover kids, or market rates? I mean, what us, when helping people with their social security number when he worked with the paper application and faxing it to coverage together. I think the under one, the slide of coverage number was fax number, so you can fax it directly to coverage kids, and that has been fast process for us. So instead of doing, I mean, they're not eligible for PE position, and they would be on representative, so.
All right. I didn't catch all of that, so I'm gonna.
I just say instead of doing market-based application online, there's a paper application.
Oh, sure. And you fax that.
Directly to cover kids and cover kids versus staff.
Okay. So what she said is what's worked for her too is to fax a paper application directly to Cover Kids. You can also fax paper applications directly to TennCare, but one caveat with faxing things, what are we going to do when we fax something? That's right, get the confirmation receipt. Somebody give her candy if she wants some. Yeah, anytime you fax something, keep that confirmation receipt, because if we get into an argument later, then we need to know when exactly it was faxed and to who. Who's next? We've got one right in the middle here. We've got one over here. Looks like one in the second row down. Gentleman there with the blue shirt. Okay, let's go with you.
I just have a quick question. There are a lot of patients that I'm having today that have already applied for Cover Kids. When they call to check the status of the Cover Kids, the Cover Kids office is sending them to the health department to get a temporary PE while they're waiting. If they apply for Cover Kids, they don't get a PE because they're not meeting the requirement for a PE. And we don't have to stop this because the patients are really upset because they've been doing what they're told. So how can this be relayed to whoever's answering these lines for Cover Kids that they don't get a PE if they're working with them?
Okay, so the question is if they have applied for Cover Kids, but they haven't gotten a determination yet, they call Cover Kids. Cover Kids is telling them to go to the local health department and apply for presumptive eligibility.
If they're undocumented, they don't meet the requirements for TennCare.
Right.
They're staying as temporary insurance while they're waiting for Cover Kids.
Well, no, unless you go buy private insurance. There's no temporary insurance. Now, what you can do and what we've had some success with, if you are actually the provider, you're representing the provider, you might even have more success with this, is that if they're eligible, and we're pretty sure of that, those bills are going to get covered. So every once in a while, I'll get on the telephone with the hospital and say, hey, only if I'm confident that they are definitely eligible. That coverage is going to start the date of application once it finally goes through. Now, for a more immediate answer to your question, that they're giving them the runaround. You go talk to this person, you go talk to this, you go talk to this person, they talk to one person, they say, no, go talk to this person, they talk to that person, and they say, oh, no, you should have been in Missouri, right? Call us. And
The main problem is that they're, when they call to check it, it should take up to 45 days, but while they're waiting, they can get PE.
right.
We get irate patients because they were told to be temporary, and that's unfortunately, the issue that they don't understand.
Right.
They're being told from the actual Cover Kids office, and then when they get PE, they walk away so,
Yeah, the best thing to do with them in the moment is empathize with them. I mean, they're up against a big bureaucracy that it can be difficult to deal with. And then,
they not understand that someone who's getting Cover Kids cannot get PE because they're getting all that.
I can't speak for what the call center representatives know, but the likelihood is no, they don't know that. Yeah, they probably don't know that, and that's why, we would actually love to have a case like that to come into our office, because when they're giving out misinformation, luckily that's a fairly simple fix, but it's affecting thousands of people in all likelihood. So go ahead and refer just one of them to us, or all of them. and we'll open up a line that perhaps fixes that training problem that's going on over there.
You know, just in general, you know, if you run into, you know, difficult client cases, or you're working with somebody, you have questions about whether or not a, you know, source of income counts, or I'm not really sure on who's exactly in the household. These are people, just give us a call. We can provide you with some technical assistance specifically about your case, or in some instances, as I was talking to a couple of gals earlier, it might be a situation where we just refer the client to us in general, which then we will, it will be assigned to a client advocate, and then we can work with it. So don't feel like you got to have just 100% of the answers yourself. If you're not really sure, you can check with us. Even if you're getting something, maybe you're talking to someone at you know, through one of the Tennessee Health Connections or at Healthcare or at TennCare, it just doesn't seem right to you. Those are situations where you can check with us for, you know, really for some technical assistance with it, or even refer the case to us. We've got a couple of questions, and one of them comes in kind of along this line. It says, we have a mother who has a job and insurance. Her daughter has 2 children, so it sounds like grandma with her daughter and then 2 grandchildren. No income, and they live with the daughter's mother. In terms of TennCare, is this a household of 3 or 4? So just in general, right, it's going to boil down to tax filing status, right, and those rules that Chris talked about. You know, who is going to be claiming, you know, the mother and the kids, or the grandchildren, for example, on their insurance, and then look at who are we trying to get insurance coverage for. Is it for mom? Is it for the kids? Are they tax dependents? Remember the specific rules for tax dependents when it comes to household counting. Look at the specific rules for dependents when it comes to counting income. Not to dodge that particular question, we would need to know more information. Just because maybe grandma wants to claim them as a dependent doesn't necessarily mean that that's what mom wants to do with it. So you need to have some understanding there. Plus, there might be a situation where somebody wants to claim someone as a tax dependent for the tax liability or the benefit that they'll get from that, as opposed to coverage for Medicaid. So there's a lot of different things that must be taken into account in figuring out what's really going to be kind of best for the family. And at that point, it might even be beyond your ability to try to help them, or even our ability. At that point, it might be coming down to what their tax advisor is going to say what's most beneficial. Is it getting the financial benefit for purely paying taxes, or is it strictly for getting someone covered on Medicaid? Kind of in the same vein of that, how would you advise someone and household size for someone who is divorced and claims the children on taxes every other year? So probably a situation where mom and dad get divorced, there's a child or children, right, and they're trying to figure out, maybe pursuant to court order, someone says one gets to claim them 1 year and one gets to claim them the next year. There's a couple points to that. One, how well do they get along, all right? And how bad do they need insurance coverage? Because there's going to be a lot of competing things. There's that benefit from a tax liability standpoint of being able to claim a dependent. If they are getting along, then I think it's a situation of taking a look at, well, you can play with the households, right? You can figure out, what if mom always claimed the children? If the primary reason is getting the kids covered, how does that play out? Is there one advantage over having one parent claim them as opposed to another? But then again, they have to get along to be able to make those decisions. And if it's a situation where they don't get along, then that's going to be pretty tough. There's really not much you can do about it. But as far as advising goes, there's a lot of things to be taken into consideration. But you can play with those households. And I think Chris's example on the blended family and where you have divorced parents and one, they always live with the mother all the time, and now you have different household sizes. You have different household sizes, you're going to have different income thresholds according to the federal poverty level. And then you might also have different income levels depending on which parent may be claiming it. So it's kind of a tough answer, but all you can really do is kind of look at it a couple of different ways, and then ultimately it's up to the parents or the applicant themselves to make those decisions.
Oh, okay.
So this one came from the audience. It's actually written down on a Post-it note. It talks about undocumented person in the hospital greater than 30 days. What is considered emergency? When it comes to emergency Medicaid, it is specifically defined what an emergency situation is. I believe the protocol is that you send in reports, documentation you have of what that emergency is. It goes to TennCare, their medical director then takes a look at it and determines whether or not it is a medical emergency. And then it's not like everything is covered, but it's only to stabilize them for that, to take care of that emergency type of situation. So if, for example, there's other care, or let's say there's rehab that is prescribed to go right along with that emergency that brought him to the hospital in the first place, that chances are that's not going to be covered. But there is, like I said, there is a toolkit that's available on our website that you can download and take a look at. These rules are all kind of outlined in there, and how to, the steps to take to approach that, how to handle an emergency Medicaid situation. When it comes to emergency Medicaid, those are primarily MAGI categories. We didn't talk a lot today about non-MAGI categories like the disability-related ones, or choices we didn't talk about in each detail, or institutionalized status for people that might be in a hospital greater than 30 days. But when it comes to emergency Medicaid, that is going to be limited to only MAGI categories. So primarily caretaker relatives, children, and pregnant women.
So, and also, as far as what the definition of an emergency goes, it does have to be a sudden onset. So chances are, if they've been in the hospital for 30 days, that's well past what anybody would call a sudden onset, unfortunately. So examples of things that people end up in the hospital for that is not a sudden onset. Perhaps their blood sugar got way too low and they went into a coma because of diabetes, not a sudden onset. They need dialysis, but they're not getting it, and so they ended up in the emergency room with a lot of problems. Not a sudden onset. My thumb gets ripped off by a saw, that's a sudden onset. So those are, I mean, obviously it's more broad than my thumb getting ripped off by a saw, but it does have to do with the medical condition. Let's take a couple more from the audience, and then we've got more from the webinar too. So this woman right here.
Hi, you guys talked a little bit about presumptive eligibility for children and women, and I know that hospitals are doing presumptive eligibility for parents and caretakers. Is there anybody else who's doing presumptive eligibility for parents and caretakers besides hospitals?
Well, so I think what you're referring to is hospital presumptive eligibility, which is a somewhat new thing, and the answer is no. Nobody is doing presumptive. The question was, is anybody that hospitals are doing presumptive eligibility for caretakers and relatives? Is anybody else? The answer is no. Who's next? Anybody else have a microphone at this point? Over here. Just shout it out. I'm not sure, so I'm gonna.
I'm not sure you're going to get. It's just like any other application. You're not going to get the retroactive.
So if someone is discharged from the emergency room,
Well, I don't want to just on individual specific cases. If you have those, you probably need to bring those to us because there's a lot of things that goes into emergency Medicaid. The main takeaway is it's a sudden onset, it's an emergency type of situation for it, and it's only to stabilize that person at that point in time. Now, what has happened in some of the past is anybody that came in and was adopted, let's just submit an emergency Medicaid application. And the problem with just doing that is if you don't follow specific rules, somebody comes to the emergency room and it's, they're coming because they got a cold or something like that and are seeking for treatment, that is not going to be covered. So I would recommend the situation that you're talking about specifically, come and talk to us after, and then we get a little more of the details on the specific case and see. But in general terms, when it comes to applying for TennCare, we know we don't have, Tennessee has a waiver on the 90-day look-back period. So it's going to be real important that those applications get submitted when when the person comes to the hospital or needs help. I mean, that's going to be really key because we don't have that. We have a waiver for that 90-day period.
So, just the second part of my question, who do they appeal to when they're in the emergency room and someone go down there and help them apply for emergency room? Because oftentimes they can't find anybody to help them apply.
Well, that's something the hospital has to do. I mean, there's specific reports that have to go in that document what that is, because the process is it goes to their review unit. That review unit then takes a look at, the reports that they have that indicates that this is sudden onset and it's an emergency. And I'm going a little bit off the top of my head here. The best thing to do is to look at that toolkit on emergency Medicaid because it addresses a lot of these particular issues that you're talking about that we have with it. But that's the reason why. The individual himself is not going to be applying for it. Emergency Medicaid is going to be typically applied by a hospital.
I know one of the issues with emergency Medicaid, hospital PE, things along those lines are simple matter-of-fact scheduling issues. That a hospital may not have a navigator on staff at 12:05 in the morning on a Saturday. This is a difficult situation to navigate. What I recommend you do is, one, it's going to require an appeal. And so we have seen situations where the navigator can sign a statement saying this is why they weren't applied for until Sunday. That's an ongoing case. We don't know if it's going to work yet, but it's at least one potential workaround with, that may or may not be successful. Other than that, it's a very difficult situation. Right here.
I mean, I heard your question to be, what should a patient do when they're in the emergency room and the phone is hanging off? And they should request to speak to a social worker. And I know hospitals have called in a social worker to get that application, and especially, these cases, I should have told you earlier, I just left in here, these litigation units. So these cases, usually the patient will come in at 11 p.m. Right, you got 1 hour to get that timestamp on that fax and application. And the best thing that any patient can do is ask to speak to a social worker right away. I think that it's pretty common knowledge in certain communities about emergency Medicaid. At least that was my experience. And just think they just need to know who to ask for. A patient advocate or a social worker. And I know, again, not to repeat myself, that I actually know that few hospitals will call in a social worker.
Okay, we actually need to move on to the next section here so that we can get you all out and into rush hour. But I want to thank the former TennCare attorney for her contribution there, and we will not hold it against you. And with that, our outreach coordinator, Katie Alexander.
Hey y'all! So I got here like 30 minutes ago and I've already had like 30 pieces of candy. So if I'm talking too fast, excuse me. And if I fall asleep in 20 minutes because like my sugar high has gone down, then also excuse me. So we're going to shift gears a little bit, and I'm going to talk about the coverage gap for the remainder of the afternoon, and then we'll wrap up and send you all home until tomorrow. But I'm just going to talk about, okay, I have to do it for the webinar. So I'm just going to talk a little bit about the coverage gap, because so far what you've learned today is all about making sure that people who do have access to care or are able to get access to care are getting that. So making sure you know, how do you count the households correctly? How do you make sure that you're counting their income correctly? Tomorrow you'll go into all the different kinds of categories that people can be eligible for. What we're going to talk about right now is the people who, no matter how hard you try, no matter how much knowledge you have, they're just not eligible for anything.
And so we'll talk about what that means, why that is, and what we can all do as advocates for that. Everybody here has such a strong voice for this issue. I mean, a lot of you work directly with patients. A lot of you work with people who are in the coverage gap who don't have access to care. And that means that you have a really powerful voice. And so with knowledge and having a powerful voice comes a little bit of responsibility. And so we'll talk about what you can do and how you can take action to make sure that everybody has access to care. So we'll talk about what the coverage gap is and how it affects Tennessee, what's the solution, and what we do to get there. So to start out with just the basics of the coverage gap. So the coverage gap is this idea that there are 280,000 Tennesseans who don't have any access to care. And we have the opportunity to cover them using federal funds, and actually 31 other states have done that. So 31 states have used available federal funds to make sure that all of their citizens have access to health care coverage. Tennessee and 18 other states have decided to not use those federal funds. And that's something that we just need a plan for our legislature to pass to make sure that we are using those federal funds and we're making sure people are covered and make sure our hospitals are safe and we're bringing money back into our economy. But that's what the coverage gap is, the fact that 280,000 Tennesseans don't have access to care and we have the opportunity to cover them. So there are a couple of ways that this affects Tennessee. So the first and most obvious way is how it affects people, the people who are in the coverage gap. But it also affects our healthcare infrastructure and it affects our economy. So I'm going to start with the one that I think for all of us here, this is the one that's closest to our hearts, the fact that this affects people who don't have any access to care, and a lot of times we are talking to those people every single day. So the coverage gap means that someone is not eligible for TennCare coverage or marketplace coverage. So TennCare coverage, you'll go over a lot of the categories tomorrow, but basically TennCare only covers you if you are low income and you fall into one of these 5 major categories. So that's children, parents, pregnant women, women with breast or cervical cancer, and then some people with federally determined disabilities. If you are low income and you don't fall into one of those categories, most likely you're not eligible for care. So I was listening to this on the webinar earlier, and Chris Coleman said that he had a legislator who was shouting in his face saying, everybody is eligible for care. Everybody, if you are poor, you are eligible for TennCare. And that's not true. That's just not true. But it just goes to show that so many people think that's true. So there are a lot of people who will tell you, absolutely 100% everybody is eligible for TennCare. You just have to be poor. And if you've worked in this field for more than a week, then you know that that's not the case. So you have TennCare coverage that does cover some low-income people if you fit into that category. And then you have marketplace coverage, which you all know about marketplace coverage, and that's if you are making above the poverty line. So you can get those subsidies if you have income that's above the poverty line. If you're below the poverty line and you don't fall into one of these categories, most likely you cannot get health insurance. So that's the coverage gap. That's 280,000 Tennesseans. That's 24,000 veterans. More than half the people who are working in the coverage or who are in the coverage gap are working. So like I said, so many people don't know that this exists. So many people don't understand this. So I just want to pause for a second and see if there are any questions about what the coverage gap is, because I want to make sure that everybody here is an expert on what the coverage gap is. Yeah.
Ages 21 to 64.
So yeah, so if you, oh sorry, the question is that between the ages of 21 to 64? So in terms of if you're a child, then you can get care if you're 18 or under. You'll learn about medically needy spend down tomorrow, I think, which is a way that children can get coverage if they're under 21 as well. But for the most part, this is coverage for people who are 18 and over. And actually what closing the coverage gap would do would make the age of being a child essentially 21. But yes, so it would cover everybody who's 18, between 18 and 64. Once you're 65, you have access to Medicare. Yeah.
So my question is, if the person isn't eligible for TennCare or the marketplace, but does have employer private insurance offered, they would still be considered in the gap if they don't utilize that, correct?
So if they can't afford their coverage that they're offered from their employer, then they would be considered in the gap. Something that, and we can talk about this more later, something that was a part of Insure Tennessee, which was one plan that was designed to close the coverage gap, is that for people who couldn't afford that coverage, Insure Tennessee would have given them a subsidy to pay for that coverage. That's not in the new plan that's out there, but if you can't afford your coverage, then yes. Okay, cool. So again, this is something that a lot of people don't understand. You are now all experts on this, so you can go forth and spread the word on what the coverage gap is. A couple other things about the coverage gap. Like I said, there are 280,000 Tennesseans who are in the coverage gap. 54% work at low-wage jobs. It includes 24,000 veterans. Many can't work, but they would if they could. So they're stuck in a situation where they need health insurance in order to get the care that they need to get back on their feet, but they need a job to get health insurance, but they need health insurance to get a job, so they're stuck in this cycle and they're not able to get back to work, even though if they just had the care that they needed, they could get back to work. So if you're in the coverage gap, you have reduced use of timely preventive care services. You're shadowed by medical debt. And so medical debt is the largest reason for bankruptcy in Tennessee and actually in the country. And then you're at risk for catastrophic illnesses that could be prevented. And so you don't have access to chemotherapy. You don't have access to even checking this to get a mammogram to see if you have breast cancer. So this gentleman who's up here, Bruce Parks, Bruce is up in Northeast Tennessee, up in the mountains. He grew up there. He's worked low-wage, labor-intensive jobs his whole life. And a couple years ago, he had a widowmaker's heart attack. So he had a heart attack. He was airlifted to Knoxville, to a hospital in Knoxville. Wasn't expected to survive the heart attack, but he did. So he got the care that he needed at the hospital and then was sent back home. He was sent back home with $300,000 in debt and no follow-up care. So he was paying out of his pocket to continue seeing a doctor, continue to work. His doctor said, if you continue to work, you will kill yourself. His heart was working at 15%. He was working manual labor. And so now, because he can't get a pacemaker, because he doesn't have insurance, he can't work at all. And so he still has this $300,000 debt. He can't work. He can't get a pacemaker so he can get back to work. So it's just one example of how you can be stuck in that cycle where you need that care to get back to work. You need to work to get that care because there's no other option. So speaking of our healthcare system, one reason why this is so vital for our state is that our hospitals are at risk now, more so now than they have been before. And that's because of changes to some of the funding through the Affordable Care Act. So when the Affordable Care Act was passed in 2010, part of the Affordable Care Act was that every state had to make sure that their low-income citizens or low-income residents had access to health care coverage. That was part of the Affordable Care Act. So when that happened, the hospitals agreed to not take quite as much funding from the federal government to help pay for uncompensated care. So the hospital said, cool, we're going to have everybody who comes through our doors be insured, so we don't need as much help with uncompensated care. So federal government redirected that to make sure that people, to go towards paying for insurance. In 2012, when the Supreme Court, when the Affordable Care Act went to the Supreme Court said that not every state had to expand their program to cover low-income folks. But the hospital funding didn't change. So now our hospitals have gotten a cut. They're not getting as much money to help with uncompensated care from the federal government, but they still have people coming in who are uninsured. So they still have to pay for uncompensated care. So the results of that, at least 7 hospitals have closed or drastically cut. That's left 4 counties completely without a hospital. There are 4 counties who have lost their only hospital since 2014. There are 27 more hospitals that are at risk of closing down, and this is a map of the counties that are at risk of having their hospitals closed down. So this is a really scary situation for these communities. So this is not just about people who are in the coverage gap. This is about anybody who, with insurance or not, if you need a hospital and you live in one of these counties, this affects you. If you drive through any of these counties, this affects you. And that's a huge impact on the local communities, where often those hospitals are the largest employers of those local communities. So another aspect of how this is affecting everybody in our healthcare system, on average, we all pay about $1,000 more per year for a private family plan because there's so many people who don't have insurance. So that $300,000, Bruce Parks is not going to be able to pay Knoxville $300,000. He doesn't have a job right now. He's been working low-wage jobs his whole life. There's no way he's ever going to pay off that debt. That means that that hospital is not going to see that money. That means the hospital eats that. And that means that the hospital is going to start charging insurance companies more money. That means insurance for services. It means insurance companies are going to start charging everybody else more money. And so we've been seeing this happen I'm sure all of you have heard so much about everything that's going on with the marketplace in Tennessee. States that have closed their coverage gap, their increases in premiums are significantly lower than in states that have not closed their coverage gap. States that have closed their coverage gap have more stable marketplaces in terms of how many insurance companies are involved in their marketplaces than states that haven't. So this is affecting our healthcare infrastructure in so many different ways. One more point on the healthcare infrastructure, it's estimated that closing the gap result in 16,000 more diabetics receiving diabetes medications, 9,000 more women receiving mammograms, and October is breast cancer month, so that's something to be thinking about now especially. 10,000 fewer people with catastrophic medical expenses, and 300 fewer deaths per year. So if we close the coverage gap, this is what we're looking at. We're looking at covering 280,000 people and accomplishing these things as well. Okay, so one last piece to talk about before we go into what this means for all of us and how we can use this knowledge to advocate how this affects our economy. So the way that the funding for this works, for a plan to close the coverage gap works, is that every state pays into the federal government taxes for a plan to close the coverage gap. So every single state, whether or not we have a plan or not, we're paying for a plan. So we're paying already for a plan to close the coverage gap. Our federal tax dollars are going towards this plan. If we had a plan to close the gap, then we would be bringing that money back down to our state. So our federal tax dollars that are already going up to DC would be coming back down to pay for a plan. Part of what Insure Tennessee is that all of the remaining money that, the remaining costs that weren't covered by the federal government would be covered by the hospitals. So essentially, there wouldn't be any cost to the state. It would be using federal tax dollars that we already are giving out to DC, and the rest of it would come from hospitals. So that was the plan for Insure Tennessee, and I'll talk a little bit later about what that looks like for the new plan, the 3-star health insurance pilot. But that's one possibility for closing the gap, is making sure that the state doesn't have to pay for any of that. So just to reiterate what happens with the federal funding, in 2014, if we had a plan to close the gap in 2014, federal government would have paid 100% of that. We didn't do that in 2014. So we lost out on that. And we lost out on $1.5 billion in 2014 because we didn't take advantage of that. But if we had a plan to close the gap in 2017, federal government would pay 95% of that cost. It would go down to 90% by 2020. It would stay at 90% after 2020. So if we had a plan to close the gap, the federal government would pay 90% of that plan by 2020 and beyond. So just to reiterate that, because it's something that was very confusing to some of our legislators in 2015, that means that the federal government would pay for 90% of the plan by 2020 and beyond. The hospitals with Insure Tennessee and what we expect to see with 3-star health insurance pilot would pay for the remaining 10%. So, pop quiz. How much are we paying in local taxes? Zero! Exactly. $0 in local taxes. This does not cost the state any money. Again, just want to reiterate that. Some of our legislators didn't quite understand that when they were asked to vote on it. So $1.4 billion per year would come into our state if we had a plan to close the gap. We create 15,000 new jobs. And again, this doesn't just affect the hospitals. This doesn't just affect the people who are in the coverage gap. This affects the entire economy. So this means that if you have a hospital who now has more money coming in, they have money for janitors, for construction workers, for deli owners. The nurses that are working in that hospital are going out and buying lunches at the local delis. This affects the entire economy. A couple of ways that we've seen this work in other states. So Kentucky, our neighbors right to the north, they have a plan to close the coverage gap. They've seen $1.16 billion infused into their economy. They've had a reduction of $1.15 billion in uncompensated care charges to their hospitals. They've seen 5,400 new jobs and 12,000 in healthcare services, 12,000 new jobs in administrative and support services. And if you think about who else is for this plan, actually a more recent poll shows that more like 70% of Tennesseans support a plan to close the coverage gap. And if you break that down by party, 49% of Republicans support closing the coverage gap. If you break that down to self-identified Tea Partiers, then you have 42% of people who are in the Tea Party support this plan as opposed to 40% who oppose. So this is supported by everybody. Everybody agrees that this is a good idea, including hospital leaders across the state, business leaders across the state, advocacy groups across the state. So it's time that we close the gap. Everybody agrees that we should be doing this. Tennesseans agree it's right for our state, it's right for our people, it's right for our hospitals, and it's the smart thing to do. So whatever it's called, we need a solution. Insure Tennessee was Governor Haslam's plan to close the coverage gap in 2015, and it didn't pass. It went up in the legislature 2 years, and it didn't pass in 2015 when it came up the first time, and then in 2016, it didn't come up. So it was a good plan. It was something that our legislature should have passed, but at this point, they didn't, and it doesn't look like they will. So we need a plan created by Tennesseans. We need a plan that is approved by the federal government so we can get those federal tax dollars, a plan that can pass in the legislature. And again, Insure Tennessee was right on those first 2 points, close the coverage gap, but it's not possible by our legislature. And so that takes us to the 3-Star Healthy Pilot. So how many people have heard of the 3-Star Healthy Pilot? Excellent. Yes, great. So the 3-Star Healthy Pilot is a new plan to close the coverage gap. It's created by a task force of 6 legislators, including 4 of the most conservative legislators in the House. And it closes the coverage gap in 2018. So I know that there are a lot of us in this room who have been fighting to close the coverage gap for years, and to think about it closing in 2018 is not really what we want to see. We know people who are affected by this. We know people who can't wait until 2018 before we close the gap. But right now, this is the only plan that's out there that looks like it can be passed in our legislature. And the fact is that it does close the gap in 2018, and right now it looks like that's all we've got. So it's a work in progress. It's still going up to CMS, the Center for Medicaid and Medicare Services. It's not finalized yet. The task force is working with TennCare and with the federal government to come up with a plan that the feds will approve. And the way that it works is it happens in 2 phases. So you have phase 1, which would cover veterans with an honorable discharge and people with a mental illness or a diagnosis of substance abuse who are under 138% of the federal poverty line. So it starts with those categories, and then 12 to 18 months later, there will be some circuit breakers. So it'll look and see, okay, has this plan cost us any money? Is this plan working? Are people utilizing health insurance? As long as those circuit breakers are not triggered, then we get to phase 2. Phase 2 closes the coverage gap. It ensures everybody who's under 138% of the federal poverty line. So once we get to phase 2, it's just as good as Insure Tennessee. We just have to get to phase 2. So it is more conservative than Insure Tennessee, especially in the fact that it's going to just take longer. And like I said, a lot of us, that's really hard to accept a plan that takes longer than Insure Tennessee would have. But the task force members are sincere. They have no reason for getting this far and not wanting to have a plan that actually closes the coverage gap. CMS and TennCare are working on the circuit breakers together, and they want to see the coverage gap closed. They want to see those federal dollars coming back to our state, and so they're not going to create circuit breakers that are easily triggered. And it closes the gap. In 2018, it does close the coverage gap. And it's the only ship leaving the harbor right now. It's the only plan that we have that looks like it's going to make a difference and close the gap. So task force and TennCare is going to work with CMS on it. CMS will only approve a plan that closes the coverage gap. So from TJC's perspective, we will support the 3-Star Health Insurance Pilot if it's approved by CMS. Because CMS historically, through the other states that they've worked on their waivers with for a plan that closes the gap, they have not supported any plans that have not been good for people who are in the coverage gap. So if CMS approves it, we'll support it. And the task force will then, so once it's approved by the federal government, the task force will then bring the plan to the legislature in early 2017. If it passes, coverage gap will close in 2018. And if it fails, we don't know when the next opportunity will be. This is kind of do or die right now, because if this fails again this year, it'll be very difficult for it to happen, because then we're going to hit another election year. We're going to hit the governor elections, and things will just be very difficult to pass after this. So this is our opportunity. This is the time to come together, to partner together, to close the coverage gap. And that's where we get to, oh, maybe not. Okay, we need to do everything we can to close the gap, and this requires all hands on deck. And that's where we get to your role in all of this. So before we move on to that, how much time do I have? Okay, I'm going to go through this really quickly, and then I do want to pause for questions, because I want to make sure that if you have questions about the plan, about what this means for Tennessee, that we go through all of that. So navigators and CACs and anybody else in this room who ever works with clients, ever works with patients who don't have access to care, your voices are really powerful. Your voices are trusted. People know that you're doing everything you can to help your patients, and so they trust you, and that's huge. And that means that you can do a lot to make sure that people are hearing about what this plan is and thinking about how to close the coverage gap. So a lot of that comes down to stories. Stories really make the difference. I know that for a lot of you, you know the stories of people who are in the coverage gap, but when you tell someone the story of someone who doesn't have access to care, most people are like that legislator that Chris talked to. They don't believe that it's true, and they won't believe it's true until they hear from someone who's in that situation, and they say, no, but did you think about this? Did you think about going to this clinic? Oh, no, you just didn't apply for this thing. And the person can say, no, I did everything I'm supposed to do. I've done everything, and there's nothing available for me. Those stories are the most powerful, and you have access to those stories every single day. And so you can help others advocate, tell their story, and change the healthcare system in our state. So at the back, on the table back there, as you leave, if you haven't grabbed it already, there are a couple of papers there. There's a consent form. So the consent form is something that you can, if you are talking to a patient and the patient is in the coverage gap, you can give them this consent form to sign. This consent form means that they give their permission for you to just give us this paper back. So it has their name, their phone number, a little bit about who they are, what their story is, and that way we can call them and we can tell them, we can tell their story. We can make sure that they have the tools and resources that they need to advocate for themselves. We can help them connect with their legislator. We can do a lot once we have their contact information, and you can help us get their contact information. So I know that a lot of times your days are just going. You talk to a lot of people during the day, but if you have people who are in the coverage gap, please just add this to your routine of asking them to just give us their information so we can share their story and we can contact them. All we're doing when we're contacting them is saying, hey, we got your name from so-and-so, and they thought that you might be interested in learning a little bit more about what the coverage gap is and what you can do. And so we'll be able to get to know them a little bit more, tell their story. We have a website that has 38 stories on it of people who are in the coverage gap, so we'll be able to tell their story and then connect them with other people, connect them with their legislators, connect them with other people in their communities who are working for this so that they can be voices for change. So that's what that consent form is. Make copies. I can send out a digital copy to everybody. And if you need the clinic logo, then we can put that on there as well. And if you need us to make a HIPAA pitch to your clinic, if you want to do this but you're not really sure how this works with your clinic, then let us know and we'd be happy to talk to the clinic managers with you to make sure that they know that this is totally cool HIPAA-wise. Okay, so that's all that I have. I do also have some sign-in sheets for a different listserv to get information about Insure Tennessee. So you all are on the TJC listserv to get information about training, but I also want to send this around. So if you want to keep getting information about, oh, did I say Insure Tennessee? I keep forgetting, the coverage gap, closing the coverage gap, 3-star health insurance plan. So if you want to get more information, if you want to get involved, if you want to keep getting information about what's going on, we have conference calls every other week. We have meetings across the state. Once the legislative session starts, we're going to have people coming in from everywhere, from all over the state to advocate for this plan, and we want you there. So I'm going to hand these around, and then do I have any time for questions? Did I talk too much? Okay, 3 minutes for questions. I'm sorry, I got so excited. I'm telling you, the candy. I just talked too much. Yes?
How is the 3-star plan different from insurance and the other timeline?
So the question is, how is a 3-star plan different from Insure Tennessee other than the timeline? That's a great question. The biggest difference is the timeline. So you're looking at, instead of covering everybody at once, you're doing it in 2 phases. One aspect of that is that we don't get the 90% enhanced match rate until we cover everybody. So in that first phase, we only get the TennCare match rate, which is 65% instead of what it would be in 95% in 2017. And so we expect that the hospitals will pay for that remainder. The truth is that if the hospitals don't pay for that remainder, and that has to be on Tennessee, the plan won't pass. So it goes back to this is a plan that we will completely support and we think has a really good chance of passing if CMS approves it and if the hospitals agree to pay for the remainder. So that is the main difference. There are a couple of additions to it as well. And so there's a piece in there about job placement and job training. And so it's an optional program that you can get help getting trained for jobs, getting placed in a job, which is actually a really great thing. It's optional, so that doesn't mean that you have to do it in order to keep the health care coverage. But if you want that, then you can do that. That's honestly, I mean, it's really similar to Insure Tennessee besides the fact that it takes longer. So you're not seeing full coverage until you get through the circuit breakers. Okay, I have 1 minute left, so I can do one more question. Anybody? Awesome. Okay, the other thing that I just want to put out there is that you all have really powerful voices, not just in talking about this to your people and getting stories from people, but also in talking to your legislators. So for a lot of you as individuals, you have so much power. And if you call your legislator and ask to have a meeting and tell him or her about the people that you know who are in the coverage gap, it can make such a difference. Honestly, like legislators don't hear from people. They don't get one-on-one meetings with people. People don't really call them. And right now, while they're still thinking about elections before they get into the House and they're busy with doing all their things once they're there, now's a really important time to do that. So as an individual, not as representing your organization, but as an individual, make an appointment with your legislator and ask to talk to your legislator about this plan. And sign up for our listserv. I'll pass those around right now, and I'll collect those at the end, and I'll keep sending more information to you. And thank you so much for letting me talk to you about the coverage gap. Thanks, y'all.
All right, so we're going to pass out our post-test, and while that's being passed out, John is going to tell you a little bit about independence.
Good afternoon. Just a quick show of hands. How many of you all work with seniors and or adults with disabilities? So quite a few of you all. We just want to share with you some of our new advocacy that we have. It's a program called Independence. You might have seen a flyer on the back table that looks like this. Independence is our new initiative that helps seniors and adults with disabilities live independently in their own homes, in their own communities, where research shows that they thrive and flourish the most. We have 2 areas of advocacy. We will include choices, which is TennCare's long-term services and support, which you heard a little bit about earlier today, and public benefit enrollment. Our goal is to help 1,000 seniors and adults with disabilities apply for 5 core services. Our research shows that about 40% of the nearly 200,000 seniors and adults with disabilities who are eligible for these programs are not enrolled in these programs. And I think it's because they don't know that they exist. So the first one that we help with is Medicare savings programs. Those are for people who are on or about to apply for Medicare. They help with paying the cost of the monthly premiums, co-pays, co-insurance, so it helps with the cost sharing as well.
The next program is Medicare Part D, Extra Help, often referred to as LIS, or Low Income Subsidy. It helps pay for the monthly cost of the premiums for people who have Medicare Part D. Medicare Part D is the prescription drug coverage. It also helps lower the cost of the co-pays when people go to the pharmacy to pick up their medication. The third program is TennCare, which you heard referenced earlier. And for this particular initiative that we have, the majority of the categories that we'll probably see will be the disability categories. The fourth one is called the Supplemental Nutrition Assistance Program, or SNAP. This is formerly called food stamps. This helps with people's monthly food and groceries. And once someone is 60 or older, they are able to make extra exceptions on their application where they can count the cost of medical bills that people cannot count when they are 60 and younger. So there are a lot of different exceptions for seniors applying for this program that people may not know about, and we help with that application as well. The last program is called the Low Income Home Energy Assistance Program. This is a program that helps with the cost of the monthly heating and cooling, or the utility bill. The applicant can apply once per year, and there's no limit on the number of years someone can apply. And it sends a one-time payment on their behalf to their utility company to help pay the cost of their home heating and cooling. And the federal kind of guideline for that is that it's between $300 and $600 that's sent to the utility company. So it can definitely help out a lot of people. So we help with seniors and adults with disabilities, as I mentioned. We help across all 95 counties of Tennessee, so the entire state of Tennessee. And we help with all steps of enrollment. From the very beginning, we help with screening to determine whether someone is eligible. So if you come across any seniors or adults with disabilities that you even think might be eligible, please feel free to send them our way. We do have a screening tool that we use to determine whether they are eligible, so you wouldn't have to worry about that. And we also help with all steps throughout the enrollment process, filling out the application, getting the supporting documents like proof of income, copy of IDs. We help with all of that. And we even follow up with all of the applicants to make sure that they have received the benefits for which they are eligible. And of course, because we're a nonprofit, all of these services are free. So if you do know of any seniors or adults with disabilities who may be eligible for any of those 5 core services I just mentioned, please send them to TJC. Again, I am Jonna Hall. I'm the Senior Outreach and Enrollment Coordinator, and my contact information is up there on the screen. Thank you all so much.
All right, so you guys all got your post-tests, so we'll give you a little bit of time to work on them, like a couple more minutes. And just so you guys know, we had a lot of questions today. And if you did not have your question answered and you're coming back tomorrow, we can answer it during the Q&A portion, which will be from 12 to 1 p.m. So we'll answer those questions tomorrow. If you're not coming back tomorrow, please come find me or Rob or Andy or any of our TJC staff. We'll try and answer, or we'll give you our contact information so we can follow up with you individually. Also, if you have complex cases that you cannot resolve on your own, you can refer them to us. And there's my email address up there. We do provide technical assistance for problems that you're having, and you can also refer clients to us. So I'll leave that up there in case you're interested in writing down my contact information, or come find me, I'll give you a business card. So I'll give you like a couple more minutes to finish up.
Are we going to go over the answers?
Yes, we are going to go over the answers.
Okay, sorry.
I'm ready.
All right, how are we doing? Raise your hand if you need more time. Okay, one more minute, one more minute. All right, time is up, so we're just going to go over the answers. For number 1, if you still have it in front of you, what was the answer? D, as in dog. For number 2, what was the answer? B, as in boy. For number 3, try not to change it if you're, still have it in front of you. I mean, honor system. Number 3, A, yeah. Number 4, D, as in dog. Number 5, C, as in cat. Number 6, C, as in cat. Number 7, A. Number 8, B. Number 9, A. Number 10, A or B. If you put B, we'll count because she can be D cover kids. Great. Okay, thank you guys so much. If you're coming back tomorrow, please bring your materials. We are going to do more raffles tomorrow. The winner of our t-shirt today was Anna Rossi. Anna Rossi, if you're here, go to C Devon and get a free t-shirt for tweeting the most today using our hashtag. If you are not coming back tomorrow, please get a gift from Jake Lorber in the back. We have a gift for you all. Thank you guys so much.